All right, everyone. Thank you for your patience. All right, everyone. So just asking one more time. I think some doctors will join more. So please let me know if the others are joining. So thank you so much. We'll highly appreciate that if you just respond with a yes. I just turn off the video, just waiting some of the doctors to be joining. Yes, I hope so. Everyone is, available and visible, and I hope so. You can also watch me. This is our studio, Chess Medical Academy. And thank you for joining. I was expecting some of the more doctors. I know people are busy, but we also made it through the Facebook group. I hope so. People will be joining on and off. Let's just see. How things are. But please, do tag your friends so that they got notified. Please do let them know that we have started. So thank you so much for your patience and the thing. So can we start? Those especially have subscribed. I hope so. You have joined our session. How many of you have joined us officially? So please let us know in that case. All right, yeah. So we can see a lot of that joined, and we'll be starting. As I said, guys, first day. So when we stay there for 5-7 minutes, so we already have crossed the 30. No voice. Can you hear me, guys? Just checking my sound, testing microphone. 1 2 3 4. Okay. So I might take help from 1-2 doctors in case if any issues, and some might be asking to help me a little bit, telling that if video and the audio things are so. Dr. Prakash, thank you for yes. So it's clear actually, right? Also I think it's broadcasted from the studio. So I hope so there won't be any problem as soon as we'll start actually the session. Okay, so this is first day. That is the only reason we're taking a little time, and we are always usually in time. Love to take classes, by making some punctuality and all this thing. So we also highly appreciate from the same thing from all of you to coming to classes in time. So I always highly appreciate that one. We'll also help you guys to getting some of the study partner and this sort of thing to be more helpful for all of you. So with all your permission, can we start now then actually? Thank you for your patience waiting for, I guess, 5-7 more minutes. So are we ready actually? Many also joined from our MCQ. So are you ready, guys? We can start. It's the first day. So we'll be talking more about the basic. Gradually, the more things will come up. That is like, role play and the thing. So in the very first class, we are not bringing the role play. So there's the thing. So can you respond one more time, dear doctors, before we continue actually? So those have joined the Zoom session, please respond with a yes or response with let's continue. Yeah, or if anyone is also observing in the Facebook, please message in the Facebook that we are ready, let's continue. I hope so you will enjoy the slide preparation and the things I made. This new generation updates and the thing you will find some nice things. And let me tell you, it's a very complete course actually, and under budget of course actually, very expensive. And some people have a dilemma that in Australia they provide much more things. It's not like that actually. So the course quality and the things will be similar like our MCQ, that this will be complete course. So this batch would be a good one for all of you. So ask your friend if they wanted to join. After class recording would be also provided. So these are some basic information. In the beginning, people want to know these things. Yes, definitely we'll be providing the recording and all these things. So thank you so much for joining us. Those joined, thank you so much. Now let me turn off myself because we are not doing the role play in the first class. Some of the other doctors, those are just taking this as trial. You can also take 2 more classes to get full idea how we conduct classes. So our first class today is based on history taking. This is a basic class. So it's history taking. It will be followed by some pediatrics related. This is a new addition we are doing, like some of the, things you need to know, especially in the pediatrics. So that will be a theory. I mean, in the second class will be more drawing and the things to the point. Few information will be given what you really need to know, which disease you really need to know in MC Clinical, because in MCQ we almost have to read almost all the topics, but in MC Clinical, individual topic we have to study much more. So what are the topics that's coming? We'll be also discussing more in the second classes. In the first classes, focusing more on the history taking format, syllabus, and all these things actually. Right, so with that note, let me turn off myself so that the screen will be more visible and nice for you. And as you can see, do let me know how do you feel, and at certain point, if any problem, do let me know. I'll stop and let you know things actually. So MC Clinical, we are starting our first class. This is a trial class for some people. All right, so initially in the introduction, let me give you guys some idea about the introduction of the exam. If anyone is actually quite experienced, they might not need that one, but do understand many doctors came from MCQ and they really need this part, that the introduction to MC Clinical. Difference with MCQ. Clinical exam is a OSCE based exam system. So you will get 8 minutes outside the room to read the question, and then you will be enter into the room for 8 minutes to do the exam. If this will be by the Zoom method, still it will be like 2 minute time to read the question and then 8 minutes to perform actually. Okay, so now we'll break down these things more, this 2 minute and the 8 minute things actually. It will come up in some of the next slides actually. Now moving forward, yes, my dear doctors, as you can see, 16 stations are there, and there are 4 rest stations actually. Now we are all confused. At certain point, will that be in the center in Melbourne or will it be Zoom based? We're waiting for a lot of updates in last, I think, been a year. They are just telling a lot of things, but no sure update yet. Today is 30th of January 2021. Still, it's not 100% sure that which one it will be. All we know, those people's exam were cancelled, they will be given priority. We expect from the March, April to be exam to resume. Because they have been paid to AMC, they like to, clear and make sure they appear in the exam first. That's their first priority. So if you actually plan for the exam, you might not get any date, even the exam is starting from the March or April, or I don't think so till June you will get any dates. Now the second question that comes, will it be center based and Zoom based? We have to wait for the decision. One update, we know that pesky exam has been already conducted through the Zoom method. So it depends on the border and the immigration, that if still the border remain closed, then they will be definitely taking by Zoom method. If borders open, they will be taking the center, but they like to start as soon as possible. That's we all hired actually. Okay, so 16 station for rest station. How many are the total number? 20 are the total number of the stations. Actually, that all we know actually. Okay, so next thing that's coming up now, the passing, the format in the AMC clinical exam, the format of the exam, it's important actually. Yes. That's the individual email, dear doctor. It's not like a website related thing. As I said, I mean, when it will be sure, I mean, we are the most updated academy. I mean, we'll be updating in our Facebook pages. A lot of, those email thing and things, small came. I hope so, in Brisbane last 1 year, so many emails, so many things they have uploaded, but it's not like that 100% thing. Okay. But, we are waiting that, that to be a little bit more, confirm updates. We know some doctors get email, but we are waiting for more bigger announcement. Now focus on this one, like MC clinical format for the exam. Passing is 18. I mean, if it's like anyway, sorry about like the writing the problem. I mean, if it is in any case, it has to be 10 station at least out of those 14. I just wrote it reverse. At least it has to be 10 station passing. Okay, and or even more. Now I told earlier there was 16 stations. Where the other 2 stations gone? Those are the 2 pilot station actually, and not be counted. Which are pilot station? No one knows actually. So if I ask you again, especially the newcomers, to be participating a little bit, that which one do you think is the, I mean, passing mark for AMC? I mean, just want to add actually to the newcomers actually, because you should know your target. There is a very famous quote that you should always know your target actually. So what's your target? What's your minimum target, guys? So I mean, it's better to say it. I hope so all of you want to pass the exam in one go. So what's your minimum target? Let's just involve the box, or maybe I can turn off the microphone, and for the others you can unmute and tell to. So anyone, guys? I mean, a little bit more participating will be good. 12. No, dear. I mean, the 14 one, if you count, 2 are the pilot. 2 are the pilot actually. Yeah. So 14 stage, I mean, 14 is the thing total, and the passing, I'm asking about passing station. So passing station is, again, it's said like, there's 10, at least it has to be 10. 2 is not counted. I repeat, 2 is not counted actually. Now, if I say 11 by 14, is this pass or is this fail? Please involve the Zoom section, or you can also unmute and tell, because AMC Clinical is more over interactive. We'll be interacting more in coming days with each other. Okay, so like, like the example, Dr. Smita Gupta is there. I know her very well. You can sometimes unmute and tell doctor, it will be more lively in that case to carry on the classes. Actually, MC Clinical, we don't mute the microphone, because it's first day, so we are muting because some doctor might not know, but we keep remain the thing. So 11 by 14 is a passing, 12 by 14 is a passing, 13 by passing. Now the 9 by 14, that's a fail. 8 by 14, that's a fail actually. Okay, so we don't want to get into there actually. It's the basic stuff. Next thing that's coming, this question often been asked by some of the doctors, and that thing is results is out of 14 station. What about the other 2 station? 2 are pilot station. Passing steroid says, like just now I said, this is 10, this thing has to be or more, this passing score. Can I know about the pilot station? Another innocent question by some doctors. No, it's not possible to know. Example, if we ask you, do you know which were the, your pilot question in MCMCQ, your answer will be also no. So same thing here. We actually don't know which are the pilot, but sometimes we can guess actually. That's the thing. How many days it takes to publish the results actually in MCQ? It actually takes almost a month. We have seen, and here it takes 14 days actually. Yeah, but rules regulation can be changed. As I said, rules regulation can be changed always actually. Today is 30th of January 2021. If anyone is here watching this video after 1 year, even just example, things might be changed a bit. Yeah. So coming for the next one. Now, what will happen after appearing in MC Clinical? What will happen after appearing in MC Clinical? Either pass, either fail, or there is a special another term in previously we used to say that's a retest. Now, do you know, I mean, about retest, and is that exist even? Any idea? Let's see from the doctors. Have you guys heard anything about the retest? Dr. Gupta, I mean, any idea about that one, about the retest? But not anymore. I mean, that's like Dr. Lakshmi can also interact by unmuting sometimes. I'll be highly appreciate that. So, I mean, it's no more applicable. So we don't have to think about that one, because sometime, when you search in the MC clinical exclusive group or different group, few thing came up. So there is the innocent mind always likes to ask, "Oh, doctor, what is this thing?" So retest. So retest does not exist now. It's gone, guys. It's totally gone now, actually. Yes. All right. Okay, let me check that one. Okay, I have given you the option. Okay, now you can do, I think. Yeah. So next time I'll ask anyone. Anyone can participate. Thank you so much. So the pass, fail, or retest is gone, actually. Okay. So fail, pass will be provided with certificate, and it's given in the Canberra. Actually, I hope so. You are looking forward to that one, my dear doctors. Yes. Next thing that is coming up, AMC Clinical Center. Center is 300 Laptop, Melbourne. I have a very nice video. If you see, I have a YouTube channel as well. So Sharia Ram is my name. And if you see, when I went for my exam and the thing, I have given the demonstration how to reach, because those goes from other countries, sometimes they got confused. I also tell one thing, like, whoever planning for exam, you should check your exam hall the day before the exam. I always used to do that, before my any exam, actually. So 300 Laptop, Melbourne, Australia. I mean, you can check that video by going to, about the directions are given, actually. It's very easy in Australia, because, if you take any car, the Google will take you there. But still, in spite getting there, what comes, as like an Asian doctor, like, okay, there'll be a big signboard with AMC Clinical, or, this thing, nothing mentioned. You will not see anything unless you get inside and go and see the board separately in the downstairs, actually. By the way, it's easy to understand. Opposite side, one Chinese shop, and in the downstairs, two good coffee shop, actually. The coffee is very nice. You can try that one. Yeah. So that's the information, actually. But, and you have to go the 13th and the 14th floor. There's like, one up and down floor there. Yeah. So that's the thing. Next thing that's coming up for the doctors. So we have reached up to the exam center, and let's now enter into the exam hall. So are you guys ready a little bit? I'm trying to be a little bit interactive with you guys. I mean, you can unmute and tell. I mean, just want to see if it's working or not. Yeah. Dr. Janet, can you unmute and tell now? Yes.
It's working, sir.
It's working now. Yes, yes, yes. Yeah, so we can move to the exam center, right? Like, now we can enter into the hall to see what's going on there, actually. Yes. I hope so all of you want to reach there very soon. I mean, let's just hope. Okay, now we are into the center. This is how this picture is one of the picture. I mean, it's published in the website, actually. So this is actually the original picture, actually, by Australian Medical Council, actually. So you see one thing, why I brought this picture, to give you a clear view, actually. Of course, like not like the sits things, but you have to stand, your markings are given here. And it's like a OSCE thing, you just have to rotate, like, when the bell and the thing that rang, you just have to keep changing the things. So 2 minutes, you will be standing here, and, here is your monitor. Oh, I'm sorry. Yeah, here is your monitor. So it will be displayed. It will be displayed for you to read that one in 2 minutes. Then in 8 minutes, you will be entering inside, actually. I hope so this part is clear for everyone, because you should know this 8 minutes is so crucial. Some people think, okay, that 2 minutes is not crucial, but I'll tell you more in the coming days. Those 2 minutes are also crucial to you. You can plan, plot, and execute at the same time about the cases. All right, let's not make it more complicated and get into this, actually. So the summary here, I mean, we will find our question in a monitor, and you read that one, and you enter, take permission, okay, from the examiner by cross-checking ID, and do some hand sanitize, and start your case. Right? How to start the case, I'll tell you very shortly. It's a first class, guys. If anyone is a bit advanced level, you might not find it that good. In that case, recommended to join our Tuesday class. That will be much more advanced. I'm giving more idea to my doctors, those are beginners, because gradually will be higher up the speed and things. Now, talking about resources for AMC clinical, unfortunately, in this AMC clinical side, one of the biggest reason I personally feel about the failing is might be this resource thing. Now, I see the PLAB passing rate is much higher than MC Clinical. So one of the reasons their resources are much nicer than this. The old Karen notes that have been circulated and just been modified by different people. Actually, it's been last 4 or 5 years that's going on. The same Karen note modified by them, this, that. So that thing is going on actually. And also the same thing being used here. That's the thing. So you also need to put more effort, do more role play and more opening up actually. So we'll be talking about that part, but let's talk only about the basic resource. So one is basic resource, like I put in that way the 5-star, like you can see MC Handbook of Clinical Assessment. Many of you can read this part so easily, right? But some people had hard time. So don't worry, we'll be also guiding you on the handbook in future. Don't worry about that one. Then there's Karen note. After coming the MAR one, I mean, MAR note is now in the market. So that's also a blending up of the feedback, Karen and many things. So I would say after MAR one is in the market, Karen become like a 4-star or 3-star now. But still, when you see the larger number of cases, everything you will find with the Karen. I repeat, everything you will find with the Karen notes actually in that case. So the MAR1 note, Karen note, MC handbook. I mean, these are the maximum, and then come some of them are physical examination. Now, if you are Asian doctor, I know many of you have read McLeod's, then Hutchison and these books. If you have good hold on them, you can still read it for a revision because for example, I have read Davidson 13 times, so I know a lot of pages and the tables. So, whenever something medicine came up, I still watch that book, no matter, I have to follow this guideline, that guideline, but still sometimes open up. So if you're familiar with a physical examination book, please do not ignore it. It's a mistake that, in MC Clinical, most of them follow this Telly O'Connor. It's a good book, no doubt, but your existing memory, if it is present with any different book or McLeod's or anything, or you have your own notes, still you can bring that one. Your memorization is first important, then execution, then planning, then the delivery method actually. We will work more on the delivery method this time actually. So physical examination, this is one of the things. And the good news is for my dear doctors, for physical examination, at the end of the course, we will be also providing you notes separately from our academy. And there will be also classes on the physical examination in the same budget actually. You don't have to provide extra for that. All right, so that's all the thing. We'll provide the list, we'll provide the notes and the things. So everything will be quite complete for you in that case. All right, and few additional things like clinical exam guide. Okay, I'll provide you that one. Then you will see that handbook cases system wise. In MCMCQ, we also used to do that the cases we separated just to make it easy. So same thing, here we did. The cases you will find separately and we'll be guiding on that one. John Murtagh has different sort of book. John Murtagh has a patient education book. Too many people don't know that. So that patient education book, you can read here actually. Currently, I think 8th edition has arrived actually, but anyone you can use is better. But if you can have the latest one, that's also fine. Few things are nicely given, I felt, yes. So these are the books, as you can see. Some are 5-star, some are physical examination, some are nice to know. And these are the basic resources. Some other, academic notes are in the markets, like Hill notes, Allen notes, everyone is having those. So you can just also check them. Nothing big difference with this MAR1 notes, to be honest. Yeah. So you can make a baseline with the MAR1 notes. Nowadays people are following, there's a word called trending. So trending is MAR1 notes nowadays isn't trending actually. Okay, so himself was appearing in exam and he compiled the things, the feedbacks in nice way, so that you don't have to search too much in the groups actually. So exclusive resources we will provide for you, that SMA notes, then the recall related updates we'll be providing you through the Google Drive. Of course, our classes recording, which can be also used as resources, so multiple live classes. At the same time, bonus classes we are planning. Like example, time management related we will make an additional 2-3 series of classes. Actually, we will supply them through the Google Drive separately. Okay, so that, as I said, that will be a complete course this time. So assignment notes, recall notes, then this class recording you can use. Physical examination guideline will come at the end. So we'll be providing you list, then notes, and then finally physical examination, how to do it. We'll guide you on that one actually. One question I got yesterday one from a doctor. Doctor, if it's a Zoom media, how about the physical examination? Isn't it a valid question? So in that case, what to do actually? Can we, I mean, I cannot enter through the screen and do physical examination, right? So the thing is, there is a one different word we use in AMC Clinical. It is called PEFE. So Dr. Lakshmi, do you know what is PEFE, or any of my dear doctors, can you tell me what is PEFE? I'm sorry if anyone is advanced level, they know these things, but we'll be gradually updating and fast forward more. What is PEFE?
Physical examination from examiner.
Yeah, physical examination to examiner. So do we actually have to touch the patient in PEFE? Next question actually.
No.
We don't actually. So basically we ask the examiner. I mean, say if it's like the physical examination, dear examiner, what is the physical finding of this patient? So we divide it into general and the specific. Can you tell me about the general examination finding of this? So examiner will ask you, what do you want to know? So then you will tell, in a common mnemonic will tell you for that one. So that's how we proceed this thing. Then systemic, and then there is a focused physical examination. I'll talk more about that one very soon. What is focused physical examination? What is about the other physical examination? We'll come to that one for saving time actually. Okay, so physical examination guideline, AMC handbook, of course, system was. Guys, please do not ignore AMC handbook. More emphasis you have to give in MC Clinical with the handbook compared to the MC MCQ. We still is to read much, but here we don't have much resources. So MC handbook is a nice resource for you. Right, so these are some additional, we will be exclusive providing you separately actually. Yeah. So moving forward, this batch we are also introducing and adding this bonus thing, so that people don't have to go here. They are I saw IMGs have to spend so many things actually, but because it can be provided under the thing. Like example, those teachers of ours are taking classes, we can just ask them actually, and it's okay, it's my matter, I can pay them a little extra, that's not a problem. So they were happy to. Last time we did one, they were very happy. So we will be trying to organize that one much more way. Whatever the things that has been supplied, and individual things they charge $300-400. It's not to say one doctor who is working inside Australia can guide you. It can be more than enough because they have gone through that. So we have Dr. Qureshi, she's been working in Australia for a couple of years now, and she's been a teacher in two big Australian institution before. She's with me for last 2 years as well and taking classes. In our last batch, we also had one class. This time we will take 2 classes just on this session. I mean, we are planning on that one. That will be on the CV cover, how to search job. But you might be only knowing Indeed.com and the Medicolics and that one. I mean, there is many things actually, to be honest. How to write the cover letter, how to write CV, when to apply, whom to contact, and which contact responded first. Another thing, which contact responded first. So all these things are very, very important actually. You must have seen like some of our academic doctors get job in faster way. Sometimes we tell few tricks, give few contacts and the things. We'll try that for our doctors, as well. All right, but the basic things are open up. That's like, Indeed.com and Colleague, but there are some tricks for the job, because unless you are in this field, you don't know that what things are, because I've been also worked with as a HR before. So I know, what things have been seen while recruiting the things actually, right? So that's another thing. So we'll be guiding you on these things. I mean, that's a bonus, and I hope so you all will appreciate that one. This is a really good bonus for many of you, to be honest, actually. Yeah. All right. So you can contact me, dear. I mean, we already started actually. Today is actually our opening actually, but we are telling that one as a trial. You can still, if you want, you can take the admission. You can contact me by inboxing, and we'll give you the details later. Okay. And please stay at the end till the end actually. Yeah. It's a very budget course. It's just for $99 US actually. The whole course is actually, only physical examination in Australia is $199. Yeah. So Dr. Krish will also give you hands on that one, and as well as in the gynae section. Okay. Now, some doctors, they came, the doctor, we have already done one course in Australia. Now we are just looking forward some ready-made thing. We'll do our own things, and because they don't give us any recording and the thing. So in that case, we also have the whole ready-made thing. You can see there'll be a huge number of 45 recording. Each is 3 hour, ebooks, gynae notes, medicine notes, and all this thing. Okay, everything is ready actually. So that's also available. You can always also purchase that one if you, one thing's ready-made. If you have time, it's always suggested to join us, do our classes. We'll be also providing you gradually through the drives actually. Okay, those are our students will gradually provide it through that. Those one things ready-made, it's also available with us actually. It's a complete course actually. Yeah. Now, okay, I can take some questions I can, before I stepping into our one of the first topic which I'm going to teach you guys today, that is history taking, and the pediatrics history taking. And the basic history taking actually is very, very important. You guys know already these things, but I'll be just recapitulating how to take it. Okay, so superficially we'll do today, then more deep. When you'll do role play, more points will come up. Now I like to take a little question from my dear doctors, like anything you want to ask me here actually, because your microphones are on. So feel free to ask me if there is anything actually. How do you feel so far? How's the slides and the thing and the presentation? Looks like, I don't know, because we have updated everything for 2021 actually. Yeah. So any question from my side, which I can answer you, except for when is AMC clinical exam is going to start. We're expecting March, April actually. Okay, officially we'll let you know, as soon as we receive something. Anything else? Dr. Lakshmi, anything? Dr. Smita, anything? Many people, others join. I can see Dr. Kazi, you can ask if there is anything, or you can write Dr. Annie, just pass and join. Actually, this time, one interesting thing. Yeah, someone was about to ask me something. Yes, please. Okay, I guess it's accident. All right. Okay, we can move on, right? So, okay, thank you. Then we can move on then. Thank you. A little response like this will be appreciated. Thank you, guys. Okay, so next thing is coming, our first chapter, that is pediatrics and pediatrics history taking. So that'll be nice actually. Now, in the history taking part, let's start. Before I step into history now, a very interesting point that is coming up for you guys. Now, in this one, you'll see some AMC secrets. This time we will be also sharing. We have a thing we all found always, AMC clinical, I'm sure it's very tough passing in one go. It's impossible to pass in one go. This type of lot of words. Like say, if you, before going into the word, if you make yourself weak, that's not a good idea always. So this is the thing, fear. First, you have to believe that it's always possible to pass this exam in one go. All right, and it depends on your effort, your techniques, your communication skill, presence of mind, how much you have practiced actually. This is also, if you have remembered, we always used to say that rule of 5, right? In MCQ, I always used to say that rule of 5, there is a thing. So in rule of 5, how we used to say this thing. So in the rule of 5, there was like 5 hours a day, 5 days a week for almost 5 months. We were suggesting you to study these things. The rule of 5 hours a day, 5 days a week for 5 months. We used to suggest you to do things continuously, right? So this was the thing. Now, few points. Let's see. Lack of interpersonal skill. Interpersonal skill will be talking very shortly. Many people don't do this thing. They're just totally dependent on, okay, the center is telling this. They're not making their own notes. They're not organizing things well. So that's what I'm saying, that, interpersonal skill development, more role play, becoming more confident. Many are, I saw that, they don't even go outside. How do you expect passing MC clinical? You're not going outside even always the whole day, you stay at home. And during COVID, it's different thing, but there are people I talk to many people. So some people, they don't go outside. So, I mean, you need to talk to Aussie people and you need to talk to other people. That's very important for the communication. Improper history taking. This is one of them. People take, rather than improper history taking, they took much time. So technically it's same, again, improper history taking. Some people spend 5 minutes out of these 8 minutes or even 6 minutes just in history taking. So how do you expect you will pass the exam? So these things we can work on. Time management. Sorry about the spelling mistake. Time management. So many people are very good. I saw, I mean, last batches and the thing. Unfortunately, they couldn't appear in the exam. Very good in excellent presentation, everything. But 8 minutes, they finished with 10 minutes, 11 minutes. Now that is the area we need to practice and we need to cut down things actually. Right? So this is the, I mean, presence of mind, comes up. That presence of mind will help you to cut down the things which are unnecessary. Right? Because you see, when you open a newspaper, there's so many things are written, but we read the headlines, maximum the subtitles. So in the exam, you also have to do the same thing. At least you have to tell the headline or at least the minimum subtitle, most of the areas. Okay, so this is the thing, so sometimes they are in a hurry, they totally miss the headlines. If you miss the headline, it's not a good idea. Now you will be, cut down of marks. I'll show you marks distribution, how the plans are done. Lack of communication. English proficiency is not same. I saw many countries, they are already naturally quite good. Some are from the English speaking country, some are already good. But those of you feel that it's not up to the mark, in that case, you please start communicating more with the other friends. Okay, it's always not necessary, especially in MC Clinical, it's always not necessary to make friends from the same country because you guys start talking in the same language. Right? It's very natural thing. It happens with also, when someone from my country came, it's very naturally own language thing came up. So to avoid that one, probably you can talk to someone from a different country so that you don't have choice and automatically things will be much better. Some people, those are, a bit more weak. I suggest watching news, but news is boring to be honest sometimes. So some TV series like Grey's Anatomy, House, and these things, just for development of the skill, know few new words, that will be best actually. Lack of knowledge actually. We believe, those past MCMs who have knowledge, but MC clinical knowledge is a little different actually. Individual cases, you have to raise the knowledge actually. So some people don't do that. Like example, the Kawasaki disease, you have to know A to Z. The MCQ knowledge will not be enough. I repeat, it will not be enough. You have to know A to Z of that one. Now, so that knowledge I'm talking about, actually you have knowledge of the Kawasaki disease, but here A to Z knowledge about Kawasaki disease and improvise it and modify it under 8 minutes actually, including asking patient a lot of questions actually. Okay, so to various one. Another thing, a drawback we have seen, some non-working doctors. Working doctors pass more. I mean, they have more clinical experience and exposure before they pass more. We have seen that actually, right? Or also those are recent graduate, like, just finished the internship and quickly appearing without wasting any time, they also pass. So those who have been not working for so long time, that can be a drawback in your this. So this is, I have set up that we can add multiple points, like, exam day, some people are very much stressed out. That can happen. Those are luck factors and the things, some cases. Main day, but if you have that habit, make sure that you become more confident so that it don't happen in future actually. So if you want to ask me anything, I'll be happy to answer here, guys. I mean, anything if you like to ask about the failing reason or any suggestion. Some might be preparing for a while, so I can suggest to you a few things. I mean, I'm a tutor for AMC, I'm a tutor for PLAB. So I know, I mean, these hacks very well, actually, especially. Yeah. I also used to be examiner at certain point, not of course this MC and PLAB, but in different OSCE stations I used to also internationally I used to conduct. So I know these things very well, how to, yeah. All right. So anyways, we can move forward. Thank you for that, you know, the conception is clear. So we can move forward from here. Do let me know, okay guys, I mean, if there is something. So self-skill development is very important. I mean, if you see in the picture in the left side is me in black dress with me, Dr. Amy Coastal. She's my PLAB tutor, and she's the highest station passed almost ever in the PLAB. I mean, cleared all stations, you know, literally. There's 18 stations, you know, so we have been also working with the PLAB for a while. So the things actually, but one thing we agreed on, I mean, self-skill development is very, very important for the both things. It's not like in PLAB, there is no fail. There's 50% fail in PLAB 2, which might be much more in case of AMC clinical. It's another reason that PLAB is much more organized, but the question and the things are quite similar. They also have to they have only 8 minutes as well, actually. So don't think that it's always too easy. Actually, it's only reason they're more organized. That's the thing. So interpersonal skill development, we'll talk more. Let's not waste your time here. We have another 4 months left to work on your interpersonal skill. Yeah. All right. Now it's the interesting point. I mean, this slide actually. Let me turn off myself. I'm not sure how many of you follow the Formula One race car. Is there anyone who follow Formula One? You can unmute and tell. Or please at least tell if you have seen at least one Formula One race, at least in the beginning. So response with yes or unmute and say yes will be appreciated. At least those were our, I mean, male friends here actually. They can at least, I think, has seen, I guess, Formula One. I hope so you know Michael Schumacher at least. This thing. Now you see any race, and you can also correlate with even the athletic sports, 100-meter, the first few seconds or first minute, isn't it very crucial? Forget about the 100-meter, that will be finished under. But in the first, you know, because who will come in front, because they will, you know, keep the highway busy. So they eventually wins the race actually. So I just want to give a explanation in that way, because if you know, gear up or startup is good, the first 1 minute you start in very nice way with confident and all this thing, your cases goes very well. But in the beginning, if you fumble too much, that might be a bad thing. Is it clear, guys? I mean, so when you start talking to the patient, the first 1 minute often decide how you are going to deal with the whole case actually. Okay. Some are very smart, they cover up the things if they messed up. But if you go really well in the first minute, you will do. So it's same like the race, the first 1 minute, whoever in the first 5 actually wins the final race actually. It's often happened in the Formula One. Yeah. So this I'm giving example. Let's come to the right hand side now, giving you more idea. I have divided doorway, history, physical examination, case closer. So doorway, it means, you know, you are outside the door, you have been given a question. You are outside the door, you have been given a question. So that's one of the things you need to consider. Okay, so we'll be, you know, getting a lot of question in future. So those questions will be displayed in a monitor actually, mentioning patient's age, sex, clinical scenario, and sometimes to the point things are given. You know, relevant points are often given. Just to add, guys, if the relevant points are already given in your question, no need to ask that one. I repeat, if you are already given the cervical lymph node is enlarged and painful and the thing, you don't need to ask that one. Is it clear, guys? So relevant history, if anything is already given, you don't have to ask that one separately. Again, the same team, you don't have to repeat that one. So this is one of the things to inform you guys actually. Even some clinical examination finding is sometimes also given. So that's also very important actually. And second very important point, please read your case very well. I repeat, read your case very well. Often people made a mistake. They didn't ask you about to take history. That was a case related to make a diagnosis, differential, and management. They didn't ask you to take this, but you start with the history taking in details. Already in that case, some history will be given. I mean, to the point history will be given. So you don't have to take the proper history or total history in that case. You can be more specific in that case. Will make you understand. It might be looking a little tough for some doctors. It will be more easy in coming days. Then comes the history taking. If it is asked, taking the proper history, you take the proper history. If physical examination is there, uh, you do physical examination finding to examiner, or you do directly do the physical examination. That depends on what is being asked. Okay. Usually these 2 to 3 cases are regular physical examination. Example, knee joint examination. Some mannequins are given, pelvic examination. So those are the direct physical examination actually. But we are expecting during COVID, it won't be given, even if it is the center based. Lastly, case closure after going through the DD, the management, the thing that you finish your case actually. So this is how the thing you need to progress. Please mark, maintaining the sequence also has marks. Many people don't know that. Now, if someone came here for advanced level information, many don't know for sequence you also have marks. Okay, if you don't follow the sequence nicely, you will lose marks actually. So your flow, everything, sequence, maintaining has, having some marks definitely. Moving forward after that one, yeah. So Dr. Leon is our another teacher. I mean, in this one, so he'll be also coming. He's working in Melbourne right now. He was in Queensland before, and now he's in Melbourne. So he will also come with medicine classes, and we'll be also discussing and sharing his journey and tips. Very nice, and he was my friend. He's my friend. Was I'm telling you, he's my friend. He's a good friend. So we have been in touch. He was my partner for MC1 as well. So happy to see him actually giving hands now and working at the same time. So he'll be sharing a lot of tips and experience with you in coming days. Yes. So time management thing we'll be working more actually in later time coming days. In future we'll be talking more about, because in one class everything we cannot finish definitely, like how it should be, the guideline for dressing and the thing. There's no such proper guidelines are given there. So I mean, because all our MC clinical past doctors, so I mean we all will guide you actually about those things actually, right? So there's interesting lot of videos and the points we are making actually. Yes, good dressing sense will give you a good vibe actually. Yeah. So initially, I mean, that comes the doorway. That means that is reading the question. So after that one, the thing that comes after doorway, I mean, you're crossing the door, then what to do? When you cross the door and enter, actually, you'll find the examiner first. And there will be an ID check thing actually, right? So the examiner is my ID. Okay, it's fine. Do you understand your case? You'll say yes. So please continue. So then you go, I mean, take the hand wash and greet the patient, and just turn to examiner and asking, dear examiner, is my patient is vitally stable? Now, I brought that one early because see, even before the history taking, we are asking this thing to the examiner, like, is my patient is vitally stable or not? So he will not tell you directly, he will tell what do you want to know. So then you will ask separately, pulse, blood pressure, temperature, respiratory rate. And if anything else you want to ask particularly, you can also ask that one. Is my patient is in pain? Can I continue? I mean, is my patient in severe pain? Is it stable enough to continue? Few of the term, please observe what are the terms I'm using. Is my patient is stable enough to continue? So then, they will tell you, I mean, if it is hemodynamically unstable, I repeat, if hemodynamically unstable, now they will tell you, okay, BP is 80/50 and this thing, then you have to tell different words. All right, so I want to take my patient to emergency cubicle and like to start the ABC, IV fluid, like, the breathing, the circulation, and all these things you will mention. And then, go get back to examiner again and ask, is my patient stable enough to continue? He'll say, yes, you can continue now. So please, this is a tricky part. So most of the cases, your patient would be stable, but if unstable, don't forget to mention that word, emergency cubicle. Is that clear, or do you want me to repeat that one, guys? I'll be happy to help you guys here. It's the beginning of the exam, either unstable or stable. You have to ask your examiner in that case. So these are 4 vital things you'll ask. Also, don't forget, if it's the pain case, do ask about the pain, is severe pain stable enough to continue? That's the thing. Is it clear, Dr. Lakshmi, Dr. Gupta, the others? I mean,
Yes,
many
sir.
are there. Okay, clear, right? Okay. Dr. Sylvia, clear these things? So far, understandable? All right. Great. Do let me know, guys, or raise hands, or ask me if any confusion. Okay. So far the easy parts are going on. Now, a big confusion. You see in MC clinical exclusive group, many group. Do I need to hand wash? Do I don't need to do hand wash? First of all, during COVID, hand wash is not recommended. By the way, after COVID situation, MC clinical exam has not been happened. But if it happened, what's the rules regulation? For example, after COVID, PLAB exam has happened, PLAB 2. One thing they have turned off is handshaking. They clearly given along with the question that no need to do any kind of handshake. Yes. Okay. In past, now people think that is handshaking carrying any marks? No, handshake does not carrying any mark. It depends on your greeting and all this thing, because there are some cases. Few doctors also said, doctor, I wanted to do handshake, but the patient not interested. In that case, you might be puzzled actually, because see, not everyone likes to do handshake. There could be cultural difference, religious difference, right? So it's not a mandatory thing, handshaking actually, but it's common in those countries actually, handshake. Yeah, but that does not carry marks, just to tell you. And during COVID, I think in 2021, it will be turned off. Zoom media, there is no option for handshake. If it's center-based, it will be turned off, I guess. But this handshake will not carry any mark on mark. If you just can introduce yourself, hello, I'm Sharia, okay, another interesting mistake, let me tell you, some people do. So example, when you start, some people say, hey, I'm Dr. Sharia, one of the junior doctor of the hospital. You don't need to say 2 times doctor, right? Hi, I'm Sharia. You can call me Sherry. In this way, this is like nice gestures. Hi, I'm Sharia, one of the junior doctor of this hospital. Now, another area where a lot of mistakes are there. We habituated of telling that, hi, I'm Sherry, one of the junior doctor. Please check your question. Is it mentioned junior doctor or is it mentioned GP? Okay, so that's one of the thing to be considered. That's another thing to be considered. Yeah, I'm sorry for that one. Yes. All right, thank you. So that's one of the thing. It's up to you during COVID not doing the things, and yeah. So we have to be cautious about this hand wash thing, followed by certain other points coming up. Let me show you that too. Emergency cubicle, please take note. Few of the areas I will ask you to take notes. So this emergency cubicle thing, please take notes. This is a basic thing. Step by step, we'll tell you everything. So initially what's after the doorway, enter and meet and greet the examiner actually. All right, so you see in the note that there is a ID checkup, ID check, as you can see here, and the patient is also there. All right, so ID check and asking the examiner, do you understand? Examiner will ask you, do you understand your case? Yes, you can proceed. Examinee, thank you. Right. So that's how. And before this, I was telling, about the junior doctor and the GP. Please make sure when you choose, you tell your position correctly. I repeat, please choose, take a note, guys. This is a common mistake and marks has been cut. For handshake, your mark will not be cut, but for this point, your marks will be cut. That, if you tell that, you are junior medical officer and question is telling you are a GP, then your marks will be definitely cut. Yeah. All right, so this part is clear. I mean, moving forward. And the hand sanitize. Okay, now let me ask my dear doctors, hand sanitization, is this thing is outside the room or is that thing is inside the room? Let me see how much idea does my dear doctors are having. We're taking the class in January 2021. In future, things can be changed, but so far, what we have seen, yes,
inside the room.
Inside. But in PLAB exam, USMLE exam, that's outside the room. Okay, so that's making a difference actually, yes. Because sometimes you guys also watch videos of different exams. Okay, so you might be getting a little confused. Okay, hand wash is outside. So you might be a little confused in your first station. What is hand wash? Okay, so it's in MC, it's inside the room. Clear, guys? Are you allowed to take watch? What do you think, guys? You can unmute and tell.
No.
We are not allowed. So it's a tough thing, guys. I mean, you have to have that presence of mind about the time management, actually. Yes. All right. No worries, guys. So as soon as you enter the room, ID check is done. Actually, you will sanitize your hand inside the room. Inside the room, you will sanitize your hand. So introduction with your patient. Introduction with your patient after entering, actually. Initially, I was giving brief, actually. So now, actually, I'm telling the sequence. So, so you can do the handshake. Hey, I'm Shahriar, one of the junior doctors of the hospital. Hey, I'm Shahriar. I'm a GP in this GP center or GP clinic. How may I help you today? Can you tell me what brings you today in this clinic? There's a lot of things, so please write down few points, guys. How to use the opening statements. Okay. Now I like to make the class a little bit more engaging. I might ask maybe some of the doctors I know. For example, I can say Dr. Smith, I asked to Dr. Saida Kutsia, can you tell me, what kind of opening question you want to start with, in the beginning? Any beginning question for us or for the patient? Say I'm the patient. So any beginning question for me? How do you want to tell that one?
Yeah.
Yeah, sure.
Hello, Ahmed. How can I help you today?
Okay. All right. So you said, we are not getting more. Hello, Ahmed. So you should not tell your titles in that case. See. So let's start it again. Let's start it again. No problem. It's our first day, so no problem. So let's start again.
Okay. Hello, Ahmed. I'm Dr. Kutsia, one of the GPs here in this GP
Great.
setting. How can I help you today?
All right. So your thing is fine. So then I will tell, oh, doctor, I was having pain since last night, and it's just getting increasing more in that way, actually. Okay. One more improvisation here. Okay. You say, hello, Ahmed, because probably my name will be given Shahriar Ahmed. Okay. In the note. Now, in those countries, they prefer something different. What is the different thing here? So my way of delivering this thing will be, hello, for example, your name is Dr. Saida Kutsia, right? So if I'll be the examinee, I'll ask you, hello, when we start, like you're not, usually you're a doctor, but hello, from the notes, I can see your name is Kutsia. How may I address you? I repeat the thing. Hey, from the notes, I can see your name is Kutsia. How may I address you? So you might be having a nickname which might be familiar. So you can introduce that one. For example, my nickname is people or the family members call me Sujoy. So, in that case, I can say, okay, you can also call me Sujoy or you can call me Shahriar. Because you are calling me Ahmad, but to be honest, most people don't call me Ahmad. Most people call me Shahriar. So in that case, my preference is if you call me Sharia. Okay, so this is one of the thing. So I will get back to another doctor for the same thing. You did good job, Dr. Saida. I'll get back to anyone, Dr. Tyson. Can we do this one a little bit? If you will be the doctor and I'll be the patient, just the beginning one. Because as I said, the first 30-second 1 minute is important. Okay, if someone has learned pass, any other wants to just any other just want to volunteer a little bit? Dr. Lakshmi, Dr. Samuel is here as well. Dr. Samuel can do that. Dr. Renu is here as well. Okay, I didn't see Dr. Renu is here as well. Dr. Priyanka is here. The same thing. I mean, now can we do a restart a little bit? Just want to make it clear because the first starting is very important. It must be seems might be a little unnecessary, but this part is very important because if you have the confident start, you will not be shaky and it will be like a smooth race car from the beginning. Yes, someone is ready here.
Can I do?
Yes.
Hello, I am Dr. Smita. I'm one
Hi.
of the GPs. Hi, I'm one of the GPs who is going to take care of you today. So from the notes, I can see that your name is Sharia Ahmed. Can you tell me how can I address you?
You can call me Sharia.
Hello. So can you tell me what brings you here today?
Yeah, like now, I mean, I'm not getting to that far, but like the pain and those things actually brought me here today. So thank you, doctor. I mean, this was very nice, Dr. Gupta. You did very good job, actually. I mean, you improvised it very nicely, actually. Thank you so much. I hope so others have seen that because it's segment wise, guys. It's nothing, just practicing segments, actually. And this approach and the initial part, why I'm giving emphasis, it's a small side, but it carries marks. This is the thing how Dr. Smita Gupta just has started. She will get the full marks for that one. Your history taking is just one portion, and this approach thing is totally another portion. So please be aware of that one. The good starting, smiling face, and all this thing actually really works here. All right. So as I said, any more questions? Yes, definitely, Dr. Prakash. I'll be happy to. Yes, Dr. Prakash, turn now.
Hi, Mr. Serier.
Hi.
I'm Dr. Prakash Kandil, and I am one of the GPs who is attending to you today. So before we start, I just called you Serier. Would you like to? Do you prefer any other names?
Yeah, fine. You can call me Sherry.
So what have you come to see me about today?
Okay, actually, it happened, doctor. It's been since last night. I'm having severe pain in my tummy, and it's just getting worse, with time. So just I have to quickly come to hospital.
Ouch! That must be hurting. I'm so sorry to hear about that. We'll definitely talk about that more.
Yeah. Okay. A good thing is here. Can you improvise this one a little bit more? Because now there is one more question waiting for you actually to ask me actually. Because I said I'm having severe pain. So you need to ask me another thing. I mean, you asked me the open-ended, very fine, perfect. Now a second question is waiting for you.
Is your pain severe and do you need any medication for the pain?
No. Anyone knows that point?
I think you should ask that. I'm very sorry to hear that you're having pain.
Yeah, sure.
Would you like to have some painkiller?
Yeah, that's the point. And so two nice things you said. You show sympathy. I'm very sorry to hear that you are going through this. Okay, guys. So please take note, guys, that I'm very sorry to hear this thing is happening with you. And can I give you some painkiller for your condition, which might be helpful, right? So pain in 1 to 10, that's also a nice question here, because to understand before giving painkiller. So can you tell me your pain from 1 to 10, or you can also ask do you want me to give you some painkiller for your pain? Is it intolerable condition? So nice words you can improvise. Okay, so you can ask it by 1 to 10. Do you want me to give you some painkiller? Is it tolerable actually? I mean, without painkiller. So you can ask questions in this way actually, right? So these are the nice things. And before we, because I was only talking to the patients, there's another thing that is coming after the introduction and these things. You can also turn to your, your examiner, and because it's abdominal pain, I keep telling. So what do we have to ask here in that case?
Vitals of the patient.
Yes, actually. So we have to turn to our examiner before proceeding the further history, that, dear examiner, is my patient is vitally stable or not? And now that brings that other 4 points. What do you want to know? Okay, and to know the pulse, he'll tell quickly the pulse, blood pressure, temperature. So if it's already stable, then you just continue. Okay, thank you, examiner. Let me turn to my patient. Then you turn to your patient again. Okay, so sorry for keep you waiting. So we can continue now. So another smile. So yeah. So I'll ask you more questions about the history. Is that okay? So sometimes we use some, paraphrases. Is that okay? You see a few words. Is that okay? So when you use this type of term, that raise the mark. That that shows good communication with the patient and the things. All right. So is that okay? Can I do this thing? So you have to take the permission. In our country, we might not do this kind of thing all the time, but in those cases, in Australia, probably, actually, when it's good methodically, they do that. The original doctors usually not always they do that, except for the beginning. Otherwise, in this procedural cases, actually, you need to take permission almost in the every parts. Actually, is that okay? If you're feeling uncomfortable, please let me know. Actually, yeah. So these are the few things, guys. I mean, we'll talk more because more role play will come up. I'll try to guide you guys more. There'll be with medicine of Limon will come, Qureshi. So good tutors, different guidelines you'll find nice, and you'll be more experts in coming days, actually. All right. So I just want to highlight these things more because often these parts are ignored. See, role play anyone can do easily. Role play eventually will do as well, but these small things really matters a lot. Now, sticky notes. Okay, what is this thing? It's actually sticky notes. Any idea?
Extra and the key points that you.
Yes, key points actually. If anyone from the last batch, maybe Dr. Smith, you have attended maybe just a few classes, I think, last batch. So maybe we were talking about the sticky notes, I guess, if you can remember that time. So I will give more emphasis on that one. This is new maybe for some doctors, but some of you are already habituated. Like if I show you my workplace, I mean, this is my workplace. This is one room. Shares Medical Academy. This is like room 1, then room 2, room 3. I mean, hall room, another one. So if I just show you in my workstation thing, so in my workstation, if you see so many things are given here. If you can see, and so these are my works. Some above one are pending, so these are already in progress. So different color and different things. So I'll tell you that one. So in MC Clinical, basically you will use it for making some of the tricky points. I repeat, you will use it for making tricky points actually, because when you are studying, you know it better. After a few days pass, you forget that one, right? So example, when Kawasaki disease will come, there are like 7 or 8 key points. So during class time, I will be telling you, you will be remembering it. So you try to, have this kind of small notes. And if you have a table and things like that, or a notebook or whatever things, it's better. But notebook is different because notebook is inside and this is outside. Whenever you come, you see that one, right? And it will be more useful for you actually. And this is practically proven. A few things are evidence-based. This is actually something evidence-based. Many of you have seen maybe some of your husband, their IT work and they do that. So they in the office do this kind of things. You can ask them actually. Okay, so this is something a proven evidence-based thing. These things actually work and facilitate you. So if, for example, if one of the thing you are supposed to do by say in 2 weeks, say example, we have planned to finish the pediatrics like within 20 or 25 days. You also need to finish it in 2024. When we'll give you the syllabus and you will put those things, and say example, you write the title So one you done, you just, pluck it off from there, or unless you put it there actually. So these were my pending works actually. Okay. So few you can put notes that, so that whenever you go, you can remember that one. So during pediatrics, you put the pediatric slides there in that way. Normally you should use a pin so that you can just plug that one. So when it's done, you just put it in a box. Okay. So this is a different way. I mean, last batch when we asked them, they said it was useful for them, right? By improvising things. And I also asked them, okay, sometime you guys send me some things. Okay, if I get time, I'll also cross-check those things, those 7-8 points, how you are maintaining. So that's a, I mean, way of thing. The more you will do, more you will remember, and more you will be organized actually. Okay? At the end of the day, the plan is to be more organized and remember things well. Sticky notes definitely help you remember things well. Okay. Now, the thing is, the 2-minute doorway is what to do. I mean, in the doorway side, basically we plan and execute. When more role play cases will come, I will guide you more on that one. When you are standing with that just 2-minute case. So during role play, we'll show you that one, what to think and what to do. Now, next one question is there. Do you think, I mean, do you have any paper outside the room to write down things? Isn't it an interesting question? Do you have a paper outside the room to write down the thing and bring it inside? What my question?
No.
Let's see some other opinion from the doctors. Please, I mean, yes or no, guys. I mean, please comment in the comment section. Do we have any kind of paper outside the room when you're standing for 2 minutes? So that, I mean, you can write things, as like USMLE exam, they do provide. But in AMC, does they provide? Isn't it an important question? Yeah, definitely. So usually they will not provide you anything like that. As I said, we are taking the class in January 2021. We don't have updates till then. In future, if the things have been changed in different way, it might be. Now, second question, when you go inside, sit with patient, do you have paper to write things or draw things? So this is the second question. Now the answer is yes. Because often in the management will show you if it's a prostate related problem, we draw a, just rough prostate, you see this is prostate, this is urethra, you have paper, okay? Outside, no paper, inside paper. In future, if it is changed, I mean, it will be more better if you have paper outside the room. But anyways, so that's just something about the 2 minutes actually. After the doorway, made great examine. I already said sanitize, ask about vitals, smile, introduce, ask open-ended question. These are, we just have asking. So apart from that, so these are the segments, please, keep them as a segment. So then history taking proper, we are entering the more specific now, history taking proper, then physical examination, what is office test, what is investigation, DD management, I'll guide you guys more on that one. Is guys are bored enough actually? I mean, I'm not sure. I mean, but we can do a little bit, yeah. So I mean, we can stretch ourselves a little bit for 2 minutes. That's okay. Yeah. So we have been here for, I guess, an hour. So I mean, that's easily, usually it is suggestive, when you will take classes in future, in every 1 hour, just try to, sit up, stand, and then just move a little bit, just suggestive actually, in future. As a doctor, as general people, you should also do that actually. Nowadays, there's smart watches, the good quality watches, is my one. Yeah. So, I'm not wearing it today because I want to be very in cool mind. Actually, I was also in little stress today before class. So, I mean, normally, this type of, smartwatch gives you also, like, if for 1 hour, if you're not moving, it gives you a vibe that, okay, you move, you stand up, you move, so it gives some kind of, yeah. So it's important because we doctor often don't remember, we forget. For 5 hours, we're just sitting. It is important, guys. Sometimes actually, MC is something, but your health is most important, right? At the same time. Yeah. So anyways, I think 2 minutes are done. And Do you want, I mean, 2 minutes, taking a little 2 minute break? We can just keep quiet for 2 minutes, maybe to drink water or something like that. Is that okay? Dr. Prakash, Dr. Smita, yeah. So maybe 2 minutes. Okay, guys. So if you want to just take water and the thing, if someone has a baby, you can just quickly go and check, so everything is fine. So we're taking just 2 minutes. Okay, we'll come back after 2-3 minutes. Yeah. All right, everyone. So let's not take much time, and let's keep going and starting the session again. I hope so the other doctors will be back at any second. Yes, those have kids. I know it's tough, actually. In future, we'll try to give you a 10 minutes of break, actually. Today, sorry about giving a less break, actually. In future, we give 10-12 minutes break, actually, always. Okay, guys, so let's start. I hope so. All of you are with me here. Now, one interesting thing is coming. Do you know about the passing rate for AMC? What is the passing rate for AMC clinical in cases?
20%. Yeah.
30. Okay. Maybe a little good expectation, I guess, but not bad actually. Like actually, it's in official website shows around some of the Australian websites. The official website will never publish, but some Australian related agencies and website, they show that it's actually around 20%. That means in every 5, there's usually one doctor passes actually. So I saw, I mean, when 20 people go, actually 3 or 4 passes. That's how actually happens actually. So far we saw sometimes it's little up, sometimes it's the same actually. So if you say 20 to 25, that's usually better, but I think it's less than 25. If you, in every day, do you know how many candidates are appearing? Sometimes some people might get confused. Okay, I saw 5 people passed. When you see the result in MC Clinical website, you might find, okay, 5 people pass, 6 people pass, or 7 people pass. How many candidates are appearing in one day? Answer, 40 people. 20 in the morning shift, 20 in the evening shift. Clear, everyone? So 20 usually in the morning shift, 20 in the evening shift. So the result came of that day is showing like 5, 6, 7, 8. It's that way. So it's usually that 20%. That's how actually. But don't be demoralized. I mean, that'll be fine actually. So let's focus more on the task now actually. Some of the task related thing. Let's see here. So what does it mean? Okay, let me show you. Task, let's divide into 5 segments, starting from approach and that history, physical examination, investigation, DD, and the management. Approach is something universal for all places. It always carries mark actually. It might be associated with history or might not be associated with history, but approach is always been universal. Okay, so there's like, if you see this graph, there's almost like 5 segments actually. Now the question is all the segment you have to perform at a time? A child presents with vomiting, child's presents with rash. Do you think child having breathing problem? Do you think all the stations you have to perform from history to physical examination, investigation, diagnosis, DD, management, counseling, everything you have to perform? No, we don't actually. But when we are learning, we have to learn all the process. All 5 segments you have to learn because they can give you any segment, right? So that is the thing. So, but in the main exam, you have to see the question properly, what they are asking actually. Most cases I found they're asking 3 things. I repeat, most cases I found they ask 3 things actually. Like, say, they'll be giving you, do focused physical examination, give the diagnosis, discuss the management. That's how often. Another thing like take proper history, discuss the physical examination with the examiner, and talk about the diagnosis with the patient. So history, physical examination, and the diagnosis. So this is one segment, and another one I said is another segment. One more segment is like that. Discuss the diagnosis with the patient and the differential, and counsel the patient and give proper management. So there's another 3-4 segments in that way. So some areas we just saw history is missing. Some areas history is included. Is everyone clear this segment? Because giving idea about segment is very, very important, because often the candidates, they don't check the segments well and they start taking the history, but the question never asks you for history. This is very important, guys. Even you will see many of you, when in future I'll do the role play, you will make this common mistake all the time. Yeah, last batch we also saw that. I mean, very clearly question is given, but as a natural phenomenon and natural way, they start taking the history actually. So just be careful about that. So you need to practice these things, my dear doctors. Now, feedback and the format of the exam, you need to know, like this, just following up the previous thing, feedback. So little idea about our feedback. Now, as you can see, my dear doctors, like approach to patient and relative. This is the thing area I was talking to all of you. You got my point? Approach to patient or the relative. Now, let me tell you, pediatrics cases, do you think a child would be there for you to do the conversation? What's in your mind? Let's see. Will there be a child there to do some communication? Of course not. So there will be a child's mother most of the time sitting. Even a child with 8 or 9 years, they were not there, never. They are also kids, right? But they will be never there actually. So there will be always kid's mother. I repeat, there will be always kid's mother. They will be there. Yeah. So approach to patient or the relative. In this case, mostly relative actually. So I have written something in red 7 Technique, organization, sequence, crucial, another 7. Accuracy of examination, because here is the one case we are talking about. It's mostly based on approach, technique, examination. So examination procedure, how things are given, especially those are examination procedure. And lastly, DD management, if counseling, if it is asked in any way. Another 7. So how much? 7, 7, 7, 7. Do you know how much you need to pass the exam? This is one individual station. How it is breakdown by the examiners. I repeat, how it is breakdown by the examiner. So any idea, doctors?
4 each.
At least, right?
At least 4 each. Yes.
At least 4, all of them has to be. Okay, so let me show you an original exam thing. Yeah, this is how it looks like. So example, one doctor found that one, like station 11 is one of the station and it's graded as pass. Now you see this one, marks given 5, 5, 5, 5. This is definitely pass. But if it would have been 4, 4, 4, 4, that would have been also pass. But if it would have been 4, 4, and 3, 3, now you tell. If I just make it 4, 4, and last 2 are 3, 3, will that be a pass? Answer is no. Yeah. Some rare case, 4, 4, 4, last one is 3. Now question is it possible to pass in that way? It is supposed to be 4, 4, 4, and another 4. Some cases, now there is a word coming up. Guys, please focus. Global scoring. That means the marks may not be there sufficient, but your overall presentation and everything was very perfect. So in that case, even 4, 4, 4, and one of them maybe 3, you can pass. That depends on the examiner. I repeat, that depends on the examiner actually. Yeah. Now you see, I mean, this is taken from the exam sheet, approach to patient, technique of the examination organization. This is about the knee joint, accuracy of examination, DD, and differential diagnosis. If you go to my YouTube channel, there is already knee joint examination is given. If you can search my YouTube link, I will give you later. So you'll see that one. I know how it was done, from starting to approach to communication to techniques, accuracy, and these things are given. And also one thing, I think even thyroid is given. Yeah, thyroid one was given. I think knee one we didn't upload. So the thyroid one was given very nicely there. So almost similar, like, you know, that one technique, approach, accuracy, DD, all these things were mentioned actually. It was quite a perfect case. Yes. So in future, as I said, I mean, visual time management related, lot of things will try to guide you. Now, if I tell you more, you will not understand that one. You know what do I mean that about the timing thing. When you start doing the role play, it will be more visible to you guys about the timing. I will show you that time that when you do, often it might be taking 10, 11 minutes rather than 8 minutes. Initially, I will not give you buzz because I want you to do good practice. More it will be progressing. Then I will try to give you more feedbacks actually that, you know, please do this time management, this way. Okay, so that's important actually. So this time we'll be focusing more on the time management thing for you. Next slide. Yes, more about this pediatrics history taking. Actually, history taking, we all know, it's basically depends on the format, like your opening statement, history of present illness. Now, if I ask anyone, please volunteer with me. What points we used to see even in MBBS, or if you know some points, what are some basic points for history taking? If anyone, like, you know, just to make the class a little bit more interesting.
First is history of present illness.
Okay.
Then the details about the history of present illness. Then the past history.
Yeah.
Family
Good.
history,
I mean,
social history.
one thing I like you said, like, you know, the details of the presenting complaint actually. Yes, that's a very nice point. So present illness, past illness, and like total description. Yeah, then go ahead, then family, then.
Then social and occupational history.
Social, occupational, yes. And so on, like more things that come up. Drug history, allergic history, travel history. Okay, so yeah, that's the thing. So chief complaint, then presenting history of present illness. Present history of present illness means the more description that thing. This is the basic we learned in the MBBS. Now, it's almost similar, but individual one point which started, because here we have to talk, so we emphasize that one more, same like that one. But maybe the presentation is a little different sometimes. Now let's add few things here. That is the opening consultation or the approach, like which initially I was trying to guide you guys actually. So introduce yourself, come from the patient details, like from the notes I can see, when you say from the notes I can see your name is say Mrs. Zoana. So then you know we'll understand that the doctor is cross-checking actually. So point for that. So you see the small boxes, the examiners usually have boxes like that. So when you introduce, they tick, confirm, they tick. Then so what brings you to in this clinic? I can see from the note you are in severe pain. Can I help you something with the painkiller? Can you elaborate more about your pain? So your opening consultation are done, full mark for that one. Okay, it's easy to get the full mark there actually. Also, it's easy to lose mark there actually. So we don't want anyone to lose mark in this area. Then comes the presenting complaint. If it's pain, we all know pain is related to Socrates and the thing. Then if it's headache, elaborate the headache more. Okay, when it started, how, and many other factors. The Socrates thing will be shortly telling that one, associating, relating, a lot of factors that comes with that. So that key symptom or chief complaint and history of present illness, for example, elaborating that pain more. For example, many cases are in AMC clinical are starting with pain. Many cases are starting with the chest pain, many starting with the breathlessness. So moreover, starting is something like where exactly the pain, can you rate the pain in 1 to 10, then onset, character, radiation, associated symptom, time, exacerbation, severity. In short, Socrates. I hope so everyone knows that from the MBBS level, I guess. So if you know it, please respond with yes, I hope so you know that one actually. So individual, anything you got, if it is a stool, if it is something related to baby's food, if it is a rash, very vital, another case rash, breathlessness and all these things, you have to highlight that one actually. Or even if you're highlighting pain, then you have to later ask about associated factors actually, because is this particular symptom associated with other things too? Okay, so this thing, we'll ask more in the middle part. And then previous illness like this, hospitalization, any chronic diseases. So that comes with the past medical history and this thing, family history. And especially with the mother, in this case, we usually take certain different questions we ask actually. This is just the pro forma. I'll show you the main version shortly. Sometimes we ask a special history. Example, a mnemonic I often use it. I call it TOPS and the binds actually. Okay, so I'll show you that one very soon. But this binds state for this obstetrical history, birth history, because it's a child's case. So why this child's growth might not be that perfect, or even if it is perfect, we also need to know about because the child's mother is coming, there must be something going on with the child. So the obstetric history is important. When the baby was born, what is it, a term kid, anything that is happened during the childbirth, when the baby was born, what was the weight of the baby, any initial resuscitation was required when the baby was born. So all these things are very important to us actually. So we call it the birth history actually, right? So this is just a pro forma. I'll getting into the more clear version, and followed by social, personal, drug, allergy, and all these things. And lastly, also it depends on the closing thing. So I just like to add a little thing here. While you close, what does it mean? For example, when you're saying bye to the patient, but there are a few points here. I mean, naturally you cannot say bye in AMC. Here actually 4R. First of all, refer. I mean, if it's a referred case, then you'll definitely refer. So I'm referring you to a specialist. He will do these things. So that's the refer. Then the red flag, if abdominal pain, if this abdominal pain become more serious, less to do with vomiting, the red flag things. Okay, any neurological symptom with this. So that's red flag. And review actually. So please come back to us after 7 days, or please come back to us if there is any emergency, contact us. Otherwise, tell them naturally to come back. Actually, if it's a ulcer case and pain is there, definitely after 1 month, you'd like to follow up. And lastly, you will show in that way that, here is some reading materials. I mean, there will be some books in front of you. So here's some reading materials. I want you to read them and study about your disease more, actually. It will help you understand about your condition, actually. So this might be new for some people. Those are fresh today. So a new thing, reading material, actually. Okay. Maybe not very commonly used in our country. So we don't have all the books and the catalogs here, but there we have. And you can also print out. I mean, few things you can search and just, they have all the thing in the software system. Australia, my friend, Limon, he got the job. First 3 months, his condition was serious. He said he has to learn all the software system. So those of you who have habituation of learning computer and the thing, in the beginning days, you'll really have hard time. So he was good, and he was having a hard time. So you understand this thing. Australian software systems are quite advanced, actually. Yeah. So anyways, guys, 4 are refer, red flag, review, reading material. The final one, reading material. So we'll give some book. Okay, reading material. That's the thing. And red flag, you need to know more, at least 3-4 red flags, actually, you should know. That is the thing. Okay, one more thing in the history, when you talk about the main complaints, here is an additional thing I like to add. We talk also about negative history. Now, do you know what is negative history? Anyone? What is negative history? I mean, that can be a question. When we ask that one, we are trying to exclude something else that we call negative. Say, child with rash case. You are suspecting Kawasaki disease. Now, what question will help you excluding the other things? Any idea? Okay,
Fever.
someone with fever. But fever in Kawasaki, is it uncommon or is it common? Kawasaki associated with fever, lymph node. I say negative history. You're saying positive history. I mean, you are making the case more strong here. That is the associated symptom you are asking. We need negative thing. I mean, that now you need to know the negative points of Kawasaki or the other differential diagnosis of the Kawasaki disease. Now, anyone knows what are some of the other child with rash? Some of the first role play classes would be child with rash. Does anyone know some other condition? Example, eczema. Come on, guys. Eczema, meningitis. Now you will ask, yeah, Koplik sport. Okay, well done, not bad. Anything else? Herpes, okay. This rash is painful. Okay, let me tell you, see, I mean, need more expertise, that's the thing. Can we ask this simple thing? Is there any deteriorating level of consciousness? Why I asked that one with the rash? Is there any deteriorating level of consciousness? This child is already presenting with fever, already presenting with rash. I'm asking another thing, is there any deteriorating level of consciousness?
To rule out meningitis.
Yes, so that's a meningococcemia. That's a very important DD. Fail to create impact and fail to realize the other important DD is not a good sign, actually. Okay, so this thing we have to keep that one in mind. So this is just one of the example. Okay, so example, there's another thing, weeping lesion. Any idea? Now these are now technically, I'm becoming technical now for AMC clinical. These are the things you need to learn. Weeping lesion. What is this? Where this came from suddenly? For which condition we are looking for this technical term, weeping lesion. Okay, let me make it more easy. There's also itching at the same time. No idea? Okay, you are almost there. You said the broad one. You said the broad one. Eczema is a very broad one. It's like a chest pain, you say. You have to, like, there can be contact, that can be seborrheic, that can be the other one, the regular allergic one. Which one do you think? Now the answer for that one is seborrheic. Guys, seborrheic, I also didn't teach much in MCQ, but seborrheic you have to learn here actually. Seborrheic dermatitis, weeping lesion. Now if I say a rash is started behind the ear and the fever and also on these things are there. I mean, if asking rash behind the ear and the patient, why I'm asking this, it might not be present. So any rash behind the ear in a small kid with fever. Yeah, measles. So I'm excluding measles. Everyone clear this one? So how many, now the big question is coming, how many negative history should be in your mind while, continue with the case? Yes, the correct thing is 5. If you include the current one as well, then 5, otherwise 4. Yes. I mean, Kawasaki also included technically. So Kawasaki, then this seborrheic, meningococcemia. Okay, so allergic, okay, contact, many things it can be actually. So, you can just, so this particular question will make your case more strong. Now you understand why some people got 4, some people got 6 out of 7 in different stations, because some people don't ask those negative questions actually. When you ask positive questions, you will get exactly 4. When you ask the negative one, your mark will rise. The other things depends on your sequence and how you approach, how you talk, time management, everything together is there. We saw mostly highest it came 6, 7 they don't give easily. Highest we saw 6, that's given out of every station, like 6, 6, 6, 6, 6. That's quite easy to read. Yeah. So I hope so this part is understandable, guys. I'm just highlighting the technical things today. I mean, a bit, because some are newcomers. We do not want to put into too much trouble in the first day. Okay. So example, I know some just passed, Dr. Anna Pilas just passed, then Dr. Sylvia just passed. Many of them, Dr. Kazi, then many other, I mean, not far away. I mean, it's good that you guys started quickly. Dr. Mariam is there, Dr. May is also there. So guys, so far, is it looking too tough or understandable? And if you can just respond in the box, actually, so far, is it understandable or is it sounding too tough? Okay, so far it's sounding fine actually. About the others, I mean, if others commenting, then I might be a little bit assured. Dr. Naima, can you be a little bit answering? Yes, yes. Okay, fine so far, right? Understandable. Okay. Okay, thank you. Great. And also the Facebook one. I mean, sorry, when on Facebook, I cannot follow in that way. But let's see, I mean, how they are. I mean, our Facebook people can also, first of all, if you are using Facebook, my first suggestion to you, you can turn the phone like this, because if you're just using in that way, it's looking very small. So you can just make the phone like that. It will be a better screen actually. Okay. So I hope so it's understandable. You guys can also comment. There's like another 10, 15 is attending there. You guys can also comment there as well, if it's so far understandable actually. Okay. Even if you secure one portion very well, that's also better, guys, actually. So we'll go step by step. We're not in hurry. It's not like next month is exam, right? So we'll not be hurry in that way actually. All right, so here's the thing, when asked for systemic review, I'm not getting into much deep with the systemic reviews things. You will be handed over slides and things, so don't worry. I mean, you can read those things later gradually. These things need more practice. Okay, like individual, some of the complaints need more practice actually. So this thing, systemic review, like skin related thing, this particular questions can be more important. I'll go with the more history. I'll go with the more history to make things more understandable for you. Before getting into the more pediatrics history, a little suggestion. Do daily role play. Okay? Do daily role play with a friend. It is very important. You should have a dedicated study partner. Make your own notes. Your table should be like this. Then use mobile to record your role play. See, it might be sounds crazy, and you might be confident. But when you see, when there are camera, when there are third parties are there, we become nervous compared to our original how we are. Example, I like not only take classes on the thing, I'm a TV host as well, do health programs randomly, OTT platform and the thing. So when the first time I had to face camera, I was saying, don't worry, many times when I'm taking classes and the thing, but when I see it, then I start, sweating for a time being, oh God, so then he said, okay, do you need a 5-minute break? Before it was about to be live, okay. So thankfully he asked me for the take. Okay, I know you're confident, but let's go for a take. So then, I was fumbling a little bit. Oh God, so we should not be overconfident. Some of us can be good, but we should not be overconfident. So the first program, I felt it was not that good, which I did. But the later on were better actually. Now you understand why some people fail in the first time. They understand and they realize, and then they do better in the second one. So my suggestion to all of you, you have to be very spontaneous because you don't have always much choices and it's a very expensive exam. So make sure you prepare in that way. So mobile can be a good thing. You see, when it's easy to take a selfie with mobile, it's very easy to take a selfie and a 30-second video and this thing, that thing, because you don't have to do much thing, right? But when you have to do a certain thing, it's actually become quite difficult sometimes. Okay, so just a tip actually, just a tip from my side, because I have gone through these things. Yeah. So focus on role play, making notes, follow classes well. Class to class, if you follow, I can guarantee you will do much well. Whatever things I will tell you, if you follow well, I say sleep less, but as long as you guys study well, sleep less for the mom with small kids. Some complain, doctor, like small kid things, how do that? So cut down your sleep a bit actually in that case. You don't need to sleep 8-9 hours in that case. You can cut down a little bit to 1-2 hour more. That's how you can also increase the time. Yes, but I'm very respectful to them that those have kids actually. I know it's tough actually, but you have to manage that time. And time is the most important thing. Like even if you work hard with 3 hour and 3.5 hour with kids, family, still you are sacrificing. Now you go to exam hall and if you fail, so all those hard work of 8 months to a year will be gone. So rather than this, what if you can increase the study hour 1 hour and 1.5 hour more, make it 5 hour and keep studying and pass it actually. It might be a little stressful more, but you don't have to sit for the exam, right? So that's one of the thing to, just my calculation actually, someone told doctor, I have 2 kids, you'll not understand, yeah, that's true, but just a suggestion to solve the problem actually. Yeah, it's easy to say, maybe it's easy for me to say. Yeah, I agreed. Yeah. So this is a certain thing. Now comes the main history section. Very nice, well organized. As you can see, guys, I'll turn off my video to make it clear for you. The first thing in the pediatrics, hemodynamically stability or not, when you enter in the pediatric history, you definitely have to ask the examiner actually. When you encounter the patient, hey, I'm Sherry, one of the junior doctor hospital. I hope so you are well. And from the notes I can see your name is Jane. How may I call you? They'll say, you can call me Jane, is fine actually. So Jane, can you turn to my examiner for a second, if you don't mind? He said yes. Then you turn to your examiner and ask the examiner that, dear examiner, is my patient is vital stable to continue? And then they'll say yes, you can continue. Or you can say, may I know the hemodynamic stability and what are the vitals of my patient? So say, what do you want to know? Then you individually ask pulse, blood pressure, temperature, respiratory rate, and you'll get to know if there is pain. Also, I want to also give painkiller to my patient. That's okay. Like you can go ahead. So painkiller is given, your patient stable now, you can continue. Then you continue the exam. I'm telling this scenario in that way just to make you familiar, because many doctors, when they enter, because these things are not discussed in the center, so they become, I mean, they start feeling unfamiliar. They know the history, they know the thing, but this initial what happens, they're not familiar, so this thing can happen. Okay, so our motto is to pass the AMC in one go in any way. That is the plan. So I have to follow that. Now, history of present complaint. I mean, that's the main complaint. What brings you today in this clinic? Can you tell more about that one? Then you start elaborating that one. Was it sudden or gradual? How long it was? Is it for the first time? For example, if you have even abdominal pain, you know, the same thing you can ask in that way. Pain scale 1 to 10, like this 10. I mean, if it's too severe, if it's like 7, yeah, like that. Course of action, you know, is anything relieving the pain? So, but you know, be very empathetic to the patients. Is it coming on and off, or is it continuous? Actually, you can also ask, is there any relieving factor, like, or if you move the baby, it's like relieving pain? Position changes can, you know, do you think relieving the pain or not? Any drug can relieving the pain or not? This is important. Okay, guys, one more thing I forgot to tell you guys. For example, in the beginning point, when you are giving the painkiller, when you're giving the painkiller to your patient, we also have to ask one more question. Anything you guys can add here?
Allergy. Any drug allergies?
Any drug allergy? Yes. That's one of the things I forgot to mention that time. So this is one of the things, because you are giving the drug immediately. There can be Steven-Johnson syndrome or hypersensitivity, and all these things can happen. So before giving the drug, just ask like, is my patient is having any known allergy? Or you can ask the patient directly, do you have any allergy with any kind of drug? Thank you so much. That's how, I mean, we proceed actually. Okay, so you can also add that one in the beginning note, guys. Please add that one in the beginning note actually, which you wrote earlier actually, along with the hemodynamic instability. That if about abdominal pain and you are up to give drug, please add that one, that, you know, allergy thing in the beginning you need to ask. Yeah. So onset, duration, severity, course of action, intermittent, and of course the relieving factor here. Okay. Apart from that one, the thing is coming. As you can see, associated factors, like example, fever, rash, vomiting. For small kids, these are quite important. Yeah. Okay, someone said if the patient has an allergy, nice question, how to manage that one. If known case of allergy with that particular drug, I mean, most cases it's with that particular drug, you will choose an alternative. Okay, you'll choose an alternative. Yeah. Clear? I mean, yeah, of course there are drugs, right? I mean, one group penicillin has allergy, then we give erythromycin. So we have options like that. So we'll use the other group of drug. Okay, unless allergy develops, that's a different thing. Okay, if allergy develops, so I know that's a different thing. Or urticarias, that's a different thing. But otherwise, we'll just skip that one in case they say, you know, I have allergy to this. Okay, so don't worry, I will not give you that particular group of drug that might cause any allergy. I'll give you alternative drug. Okay, well, but that's a very nice question someone asked. All right. So associated factor, pain, as you see, side onset this thing. Stated features like trauma, injury, fever, any shakiness. Small kids, it's very important to ask about the seizure and all these things. Of course, rash, so important. I'm telling in generally, but when we'll do the regular role play, your main problem will be highlighted. Either it will be child with rash. We'll highlight the rash, then we'll ask about the associated feature like fever, vomiting, blah, blah, right? Small kids will also cross-check ENT. any tugging of air, pulling of air. Because why? Tugging of air, pulling of air, this feature is present in if any kid with fever, we suspect what? So this is like a negative history, isn't it, guys? Can we say this one like a negative history? Yes, definitely. So pulling of air in case of otitis media, discharge from the air, again, something related to otitis, that's a possibility. Sore throat, there can be rheumatic fever and many other things that is also associated with fever. Drooling, anyone, this one is a tricky, guys. If anyone has good hold on the partner, they know this one. Drooling, well done. Epiglottitis, well done, yes. And lastly, unable to swallow. Yeah, so a lot of points that can be related to, like dysphagia related. Yeah, a lot of points that can be there. Yeah. ZERD and things that can be there, things like that. Any esophageal conditions that can be also unable to swallow can happen. So these are in the history. I mean, we just need a good presence of mind just to present them and finish them actually. Many cases will find child presenting with cough, productive and noisy. Okay, child presenting with cough with noisy breathing. Guys, little bit theory, let's discuss. Child presents with cough, having noisy breathing. Your diagnosis, please. At least 2 diagnoses you have to give. Epiglottitis, point to be taken. Anything else?
Asthma.
All right, that's okay. But we look for more for this is kids. Okay, they usually direct to wheeze or musical sound in that case. Noisy breathing. Just give me a second, guys. Yeah, noisy breathing usually we point out things like that croup, epiglottitis, and also some cases foreign body. Some of you are correct. So goes more with that, and bronchiolitis, then COPD is like in kids, it's quite impossible. And the asthma, that's like a musical sound, or the wheeze directly. Wheeze is also a common term. So those we are expecting more actually, but it's okay. I mean, noisy breathing, you can put it in any way. Shortness of breath, multiple factors. Runny nose, it can be more towards the viral. Okay. Nowadays, when there'll be AMC exam, don't forget to ask things and symptom. If anything with fever, don't forget to ask and about the coronavirus. Okay, I mean anything that symptom, loss of smell and the thing. Okay, please do ask in the negative history about coronavirus. I mean, I'm sure that will be added from now on. Okay, what time of the day is it hampering your sleep? Okay, anything makes it worse or better? So this is cough related question. Okay, does turn into blue? Yeah, because if there is marked breathlessness with cough and noisy, what it could be, guys? A severe case of turn into blue when coughing and maybe noisy breathing. Yes, croup. So marked breathlessness or severe croup, they can turn into blue, right? Yes. Any drooling. So these are the points. I mean, but due to pressure, many people forget these things in the main exam. Believe me, you must be thinking, okay, I mean, I've read so many things. Why someone failed? And the common thing people fail to just mention in the main exam due to pressure and lack of practice. So practice till it gets perfect. So vomiting, stool is another very big issue. Some cases presents with constipation. Then you will say, do you use any food that relieves constipation? So we'll talk more about that one. These are in general some of the symptoms in the history. So this is history taking slide. So giving you as much as idea for pediatrics and also for the future actually. Yeah. So well child or baby related question. Now please focus on this one. Baby's activities are important, right? Is moving well, position, feeding well, hydration, weight, okay, and the contacts. I mean, recently been in contact with anyone who is having the same symptom. What do you mean by contact? Is he recently in contact with someone who is having the same symptom? Please check what are the words I'm using just to make it easy. You can also see the replay later. Recording would be there. Facebook we are also broadcasting. How is child's activity? Any chances his behavior getting irritable, drowsy, feeding. I mean, feeding is very important. I mean, of course, from the mom's point of view, it's very, very important. Any changing in appetite. Are you happy with the growth? Again, are you happy with the growth? Any recent weight loss or gradual weight loss? So that comes. Do you think any kind of dehydration is present? Or you can check also in the physical examination. If you may miss this one, dehydration, you might fail the full case. Actually, we have seen in one of the handbook case, it was mentioned, fail to assess the dehydration. Okay, if it's a case where, like example, pyloric stenosis, do you think pyloric stenosis case, dehydration, is it possible? I repeat my question. Pyloric stenosis case, do you think dehydration, is it possible? Definitely yes, it is possible. So in that case, I mean, if you don't mention and take the proper history about the hydration status and the thing, and don't ask about the urinary output, or if it is a very small baby, then number of nappies. Please take a note here. Wet nappies, actually, number of wet nappies. If very less number of wet nappies, that's a sign of dehydration as well. So if you fail to ask this thing, that's a quite big error in a case like pyloric stenosis. Clear, guys? This one, individual point, I'm trying to give at least a good example of, like, in which case hydration is important. Many cases, when the child is ill, the feeding will be affected, and that might be also related to failure to thrive in some cases, right? So, like example, cystic fibrosis, very sick child, septicemia, okay, celiac. Many cases there can be failure to thrive for the babies. Child's behavior can be abnormal and drowsy in case of meningococcemia. Please always consider meningococcemia, and whenever possible, do not hesitate to talk about meningococcemia, or even ask a negative thing about a meningococcemia. Do not hesitate. But not asking can be a big issue, okay, actually, about that one. History of sick contact at home, childcare, school. Very clean question. History of sick contact at home, childcare, school. Do you feel is the child can be in contact with someone similar with similar symptom at home or childcare or in the school? Okay, so they'll tell you in that case, actually. So you also need to know some condition where the condition can be because of contact. Example, guys, a child because of contact developing certain condition. Can you mention some conditions like that? I know few, 2, 3 I can share. Which one? Can you repeat?
Pertussis.
Pertussis, okay, but pertussis is a popular case in MC, but is that common? Pertussis is very popular case actually in MC. We will come to that one, but I agree with you, actually. I agree with you, but let's talk about the common ones. MC likes to talk about the common ones, actually. So
Foot and mouth disease.
yeah, that's possible. So chickenpox, mumps, measles, rubella. Let's think about them first, then an uncommon one like pertussis. And if it is pertussis, I'm sorry asking a little advanced thing for the beginners today. If anyway it is pertussis, is there any extra burden on you to notify someone?
It is a
something?
notifiable disease.
Exactly, yes. So for a condition like pertussis, so for AMC clinical separately, you should know some of the condition where you need to notify. For example, tuberculosis, definitely you need to notify as well. So notifiable disease, definitely notify to, now a question is coming, notify to whom? Senior doctor or anyone? No one wants to add anything from our Facebook friends? Anyone? Whom to inform this notifiable disease? Someone answered that one. Okay, National Disease Control Board. One thing. Health officer, that also can be done. DHS, that can be done as well. Okay. So DHS or National Disease Control Board, you know, whatever you say, then fine actually. So few technical terms are very important. These things where, you know, your marks can be cut. So example, patient's mother is telling you, doctor, we don't have enough fund for this treatment. We are not citizen. What to do? We don't have enough funds. You know, when you at the end, they're telling that doctor, we don't have enough funds for this. Anything else? Our Facebook friends can also add few things. Yes, in that case, there is a special word is coming. What is that? Anyone? Center link. Yes. I just want to add here this thing. This is called center link. Those of you who are living in Australia, I'm sure you must be knowing about this. Center link. I mean, during Corona time, at least everyone knows. Centerlink, you know, was providing almost $3,000. Has anyone got $3,000? Please don't hesitate to tell us. Don't worry, you know, we'll not ask for anything. Okay. So Centerlink is the word we're looking for actually. And another thing I was, if someone is an, you know, not immigrant, grant or telling you they are here, their papers are not fine, I mean visa related, will you complain that one? I mean, it's the immigration department thing. Will you complain about that patient that, you know, there's an illegal person? If the answer is no, you will tell rather, see, I mean, my job is to treat you. I mean, we're not going to file about your paper and the thing, you know, you solve it of your own, but make sure you take the treatment for the baby. Some cases it does happen in that way. So Centerlink, one additional thing we found, another, this immigration related thing we found actually. So there's another new thing we just learned. Clear everyone? This part is clear. This is a very common things actually. 4R we learned, 4R we learned, and this immigration thing we learned. Okay, we have a question. Question is by Dr. Sylvia, that should we ask about any dehydration status at first about the hemodynamics? Yes, you can. If it's about asking in the beginning, you can also ask that one. I mean, say pediatric cases and the medicine cases usually almost similar, except for in pediatric cases, if you feel that, you know, it's a vomiting case and a state of dehydration thing are there, you can also ask about the state of dehydration in the beginning. Okay? No problem on that one. And now, if you don't ask in the beginning, does that mean you are failed? No, you can again ask in the physical examination. Okay, in that case, you can again ask in the physical examination actually to recover that one. All right. Okay. All right. Now we are talking about the history. Especially, I was talking a little bit about the birth history, isn't it? So birth history, nutrition, development, and how to ask any concern regarding child's growth and development. Then compared to other kids, do you feel his growth is fine? So here's your questions actually, what you really need to ask. I repeat, what you really need to ask actually given here, exactly the questions. All right, so this will help you here. Are you enjoying motherhood? Because some childs can be unwanted child, some can be, you know, stepson. So, yeah. And this one is very much mandatory. If you don't ask it, you know, your case would be very weak. Like, you know, how's the, you know, is there any problem during the baby's born? How's the pregnancy? Was it a term pregnancy? Any resuscitation required during the pregnancy? So this question, and, you know, after birth, are you happy with the development? Are you happy with the kids' development compared to the others? Okay. So then, you know, you can also ask the examiner when physical examination, asking directly about the growth chart actually. So we haven't entered into physical examination part yet. There's certain things to ask in the physical examination as well. Do you have support for the illness or financial support? Yeah, that's a nice question. This is not something. So they might tell you, no, conditions better. They'll say, okay, I'll talk to Centrelink to help you regarding that. Travel history, if you feel so, like an asthma case, if you don't ask about the pet and carpet, that can be dangerous. Now, how to remember all these things? It might be looking a little crazy here, but here, like TOPS and the bites, to remember, two easy and nice memories. So TOPS means trouble, occupation, paid, exposure, and smoking in the family. The kid does not smoke, but someone in the family is smoking, and passive smoking is also dangerous. We know that. So in total, TOPS actually. I mean, there's so many things you can ask, but these are basic, guys. I mean, there's a lot of battle, which things to ask, which things not to ask. Firstly, if it is related to symptom, you should definitely ask it. And if it is not related to symptom and you have to ask for just to make your case strong, then just ask about TOPS, travel, occupation, pairs exposure, smoking. Then, this birth history. So we just talk about that one, and how about the baby's child birth actually? Was it a term kid or premature? Was his weight is fine during birth? Any resuscitation required during the birth? All these things. How's his growth now? Has he been immunized duly? So duly immunized, guys, please, another technical term, duly immunized. Okay? So a few terms, we need to remember. Is he duly immunized with the scheduled vaccines? Yes. Then are you happy with the development of this kid? Are you happy with the development compared to others? Try to, take the answer as a yes and no from the patient. Just a very big tip for all of you. You talk about the more things, okay, after the opening statement, so that the patient answered in yes and no. That will save your time because you can be more specific and quick. But if you let it on patient's hand, most cases they will take a lot of your time actually. So this part understandable, guys. There's TOPS and the binds. If you say yes, then we'll move to next section. The TOPS and the binds. To go to next section. I'm just trying to make it more simplified for you actually. And we'll do the role play, and believe me, it will be more easy for you. We'll bring these things into the practice mode so that things will be more connected and strong. This early thing, even I have seen other institutions know some of the things. These things people don't talk much actually. No emphasis. More emphasis on role play. I appreciate that. We'll also give more emphasis on role play. Role play is main thing in MC Clinical, but these things are always, if you remember, your professor used to say history taking is an art. History taking and the thing, this is an art. It is actually true. So this approach and the history part, many people lose the mark. Okay, so that's one of the things you need to consider. MC Clinical, maybe you heard, is much more about your approach. I repeat, MC Clinical is an exam, is much more about your approach actually. Okay, so we already have gone through a few things. Presenting complaint. Just now we finished presenting. Then past medical history. Okay, we need to ask family history. We need to ask address the patient's concern. We just have gone through these things actually. Initially, I just show the format, then it's coming in more details. Now, history is done, I believe, more nicely done. All we need to do some role play to show some practical experience in future. But see, guys, don't tell in that way. This way, if you tell, it's better. So those things I'll teach you more actually. Now comes the next segment, that is physical examination. Now, the physical examination, it's always started with physical examination. General, systemic. I would add local just to make it easy. Please take a note. So see, some of the places I say take note. So physical examination, most people will tell you general and the systemic. I usually like to tell general, systemic, and local. Now, local means what? If it's a child with rash case, this individual examination of rash is important. If it's a child with rash and maybe a lymph node enlargement, A child with lymph node exam, that individual examination of the lymph node is very important here actually. So that we don't forget that thing, asking the examiner. So example, in Kawasaki disease, we have to ask the examiner separately about the lymph node. How's this lymph node feels like? Is it rubbery? Is it soft? Is it what is the size of the lymph node? Is it more than 1.5 centimeter? Okay, so all these straightforward question, we have to ask the examiner. So that also goes with the local examination. Clear, guys? So general, systemic, and also maybe the local. Yeah. So in the general, as you can see, I have written a mnemonic here. Now you can see here. Normally we talk more about pickle, but for pediatrics cases, pickled. This D stands for dehydration. Which one of the doctor asking? Yes, my dear doctor, dehydration. Asking about dehydration is very, very important. State of dehydration in the beginning or in this part, at least you have to ask actually. So pickled, please remember pickle. So when here the examiner will ask you, what do you want to know when you ask about general examination to the examiner? Okay, so pallor, negative. Icterus, negative. Cyanosis, negative. That's how the examiner will answer to you. He will not say, no, there is no sign. They don't talk in that way. So get familiar with these things. Clubbing, negative. Lymph node, yes. So now if say yes, and how about the size? How about the consistency and things you can ask immediately there if they are telling about. May I also know about the about edema and rehydration? Negative. You can continue, and sometimes they will force you to continue the next task. Okay, you can continue. I mean, because you are delaying the case actually. So some cases they might also skip the examination. I'll can you tell me about the diagnosis when just maybe 1-2 minutes left, still you are delaying a lot. Can you tell about the diagnosis and the, like, because you're delaying that, right? You have seen it in the professional exam that your examiner is, okay, tell me this one, and they go to another segment in that case. Okay, so as you can see, if it's general examination, if it's about the rash, describe the rash in details. Okay, like in scaly rash, desquamated rash. Does anyone have idea? Desquamated rash. I mean, Facebook, Zoom, whoever watching the classes. This desquamated rash is related to what? Definitely desquamated, scaly, and all these things related to Kawasaki. It will be also associated with lymph node enlargement with fever, and this lymph node is more than 1.5 centimeter. Extra point about Kawasaki, the rash comes after the fever. The rash comes after the fever. So that's the thing. So the sign of dehydration, see, this point is separately highlighted here because this point is actually very important for pediatrics. So skin tug, shrunken eyes, and all these things, you will ask the examiner separately. And may know the state of dehydration. Is it baby thirsty, skin turgor, is it fine, and negative, quickly go to the next task. Remember, as like newspaper I told earlier, if you touch the headline, then you have to think much that, okay, extra subtitle, I didn't ask so many, will I fail? No, I mean, when you touch the subtitle sign of dehydration, that means, you touch that part actually. Okay, so you are done with the examiner will give a tick when you come to this part actually. Okay, so, but if you take too much time in the sign of dehydration and, forget to ask about, is there any supplied growth chart present? Either they will supply you or either they will tell you the child is in 70th percentile or child is in the, or either they will give you something to plot. Okay, that's the thing. So systemic examination, after that, after all these things, including the vital and the thing. So guys, vital, if you don't ask in the beginning, then here you have to definitely ask again. If I ask it in the beginning, in this case, there's a technically we ask one thing. Is the vital cell as like the same as before? Just to make it that showing. I mean, few things are show off in life. So just to show off that, I'm also touching the vitals again. Is the vitals are same? So please take note. There's an area where I'm asking everyone to take notes. Is the vitals are as similar like before? Says yes, continue. Examiner will tell you that. Clear, guys? I mean, this portion is important. Everyone understood this thing? which I just said. Yeah. The important point, I mean, many people, they don't ask second time. I personally do ask, I mean, the second time actually, this thing. That, because there is room you can ask this thing, like, is the vital remains the same like before? Let's see how smartly I asked that one, because I'm not showing that, I want to know again, actually, that looks foolish, right? So I'm just asking a smart way that, okay, so it's like the same like before. Okay. So child growth chart and systemic, now focused examination. If it's about abdominal pain, focused examination, I mean, you will take more details, I mean, examination about GIT, and then the others, you will just go a little bit superficially. Okay, so that's called the focused examination. Okay. If it's related to one system, you will ask that one in details. Otherwise, you go much shortly. Is this thing is clear? I hope so. Here is little doubt with the doctors, I guess. Okay, let me tell you a few things to make it easy for you guys. Ready? Systemic examination. Systemic examination, right? Now in the systemic examination, say, if it is something related to, I repeat, if it is something related to, say, GIT. Now you guys please help me also here. In GIT, what we can actually ask, it comes with, inspection, palpation, percussion, auscultation. How many things you feel if it's an abdominal pain case? So how many things you feel you need to ask actually? Is there any gross abnormality on inspection? Like like visible mass, mark, any distension, mass, any marks, any distension, and all these things. Like in inspection, particularly, I just touch this part. I repeat, it's more about touching. So in inspection, is there any gross abnormality? When I say this thing, my job is done. Examiner may say, like, so any mass, marks on, abnormality, movement with respiration is okay, and so normal is normal. Palpation, very important. Temperature, temperature, tenderness things, and then the percussion things comes. Okay, the percussion things come. Normally it's tympanic, and lastly it comes with very important, the vowel sound. Okay, so is vowel sound present? Let's say yes, it's present. Okay. So this is like, the focus. I mean, in general, details about one. And how about the others? Now, respiratory system, will you ask in the same way as you ask in more details? Answer is no. We'll go more superficial. Any gross abnormality in respiratory system? Any added sound? I hope so you're writing. Any added sound, like any added sound, like what? Noisy breathing. Noisy breathing, because it's important here. Noisy breathing or wheeze. Okay, so you can ask this particular thing. How about, you can maximum ask about the breath sound as well, if you have the time. When you say that added sound and the breath sound, your job is done. When you say added sound and the breath sound, your job is mostly done. Now coming about the cardio, sorry, let's say heart shape, the cardio. In cardiac cases, what do you have to ask? Any gross abnormalities, any visible vein or pulse, we'll ask that one, and any abnormal sound or any murmur. As I said, we are discussing focused examination. Last but not the least, what is left? Neurology. Any abnormalities in cranial nerves, Is cranial nerves are intact? Is the sensory and motor functions are intact? Okay. So your neuro will be also done in that way. So you see, it will not, when you go fast, it will not take much time. And examiner is much more smarter than you. Okay. So this will be the focused examination. Focused examination. So one system little elaborate, other system just superficial touching. And maybe you can add the local examination separately. If it's a case about rash, ask a little bit about the rash. Is it clear, guys? I mean, I just try to make it more clear to you guys. I hope so you have written thing. If you haven't, later you can also replay this one in Facebook and write it down again. So this part is little tricky. So I want the others to respond a little bit. Hopefully it was understandable, guys. Hopefully it is understandable for you. Focus, general, focus systemic examination. Sometimes this exact line is written in AMC exam. Focused clinical examination means this thing. All right, so thank you. So we are back. It will be more clear, I can assure you, that when you will go to the doing role play in future, then this section would be much more clear to you. It might still, I know, it might be looking little different now, but when you do the role play, you know, it will be easy with 1-2 role play when you will be done. Okay. Additionally, you know, always remember our physical examination to be finished with hernial orifice, genital examination, rectal examination, right? These are some of the basic things, you know, to finish. I mean, just to inspect, they are intact or not. Genital examination is normal. Is my patient's genital examination normal? We'll say yes. Hernial orifice intact. Rectal examination, okay. Digital rectal examination is, I mean, fine. You can proceed to next task. Often they will tell you, okay, it's normal. Proceed to next task, so that you can proceed quickly. If examiner does not help you, actually it's tough to proceed very quickly, to be honest. So they are your friends. It's not that your enemy. Now, one more thing, after the physical examination, this thing must ask to examiner always, okay, don't forget, this is like a mandatory field. You know, when you fill up some form, remember, I mean, some areas are given like a mandatory field. So this is a mandatory field, guys. Don't forget this thing. So is there any office test available? This is a tricky thing in MC clinical exam. Is there any office test? Now you guys please tell me, what do you mean by the word office test? Office test, examiner asks whom? Patient or examiner? Examiner, definitely. When we turn to physical examination and this thing we ask the examiner, is there any office test available? So what do you think, guys? What to do? What are the office tests? I mean, those are Facebook following. They can also write few things. What are the test, guys, here? Yes, bedside test. Well done, Dr. Naima. Can you also mention, I mean, at least 1 or 2 name? Anyone? Like starting with urine dipstick, blood sugar, ECG. Some cases this is spirometry. Okay, so these are the office test. It is mandatory field to ask in every exam. For pediatric field, you also need to ask about, is there any growth chart supplied? I repeat, is there any growth chart supplied? Separately need to ask. Is there any radiology available? But most cases, if it's radiology available, they usually mention it and you will find it near to you actually. Yes. Okay. So that's about the examination thing. That's about the examination thing. Then there will be a part that is investigation. So sometimes, you know, it will be mentioned in the question. So you have to talk about the investigation and tell to the patient. Remember, investigation you have to tell to the patient actually, mostly. And lastly, DD, diagnosis and the management. Some cases DD separately will be mentioned. So in that case, you also have to mention DD. So with all the summary and the notes, I think this is a case of Kawasaki disease. And have you heard about Kawasaki disease? They'll say, no. What is it, doctor? Is it serious? It can be more serious actually for now. I mean, so you will explain it's a vasculitis type of disease and now it's related to blood vessel. Use as simple words as possible. So that explanation also carries mark. Then you will have to tell what to do actually, right? Like IV immunoglobulin, aspirin, that thing. They might ask about the Ray's syndrome. We'll discuss the child with rash, don't worry. So those things will come later. Patient also asks you questions. Now, one thing, does patient ask questions? Yes, they do. They do ask questions actually. Okay. So you have to be ready with that one too. And during the management part, they ask more questions actually. Right. So they might ask you 2 more questions additional actually during the management part. Is it very serious? Am I going to die? Can my baby go to school soon? Yeah, so these are the things. All right. Now some popular clusters, guys. As I said, we'll be starting and do things more in coming days, but giving you guys full idea about how the pediatrics, we do the theory part. I mean, next class we'll be discussing a little bit more about, I'll give you a gross idea about the theory things. I mean, definitely MCQ is a little different. Those things are fine. I mean, important. I mean, you can also give a revision. If anyone from my academy, they should have good hold on the theory part, definitely. But I mean, here there might be mixing of doctors. So I need to give you guys idea. Like example, fuzzy eater, this thing we don't teach in the MCQ much actually. So you have to tell more details about that. Child with rash. Here we highlight more actually compared to the MCQ is also important, but it's quite disease specific. Here it's much more the cough, vomiting, jaundice, and all these things. I'll also show you individual recalls separately. Those have been tested in last 2 years actually. So that you will be totally assured, not only the theory, but the recalls too actually at the same time. Okay, so this is the cluster. When you start preparing for the first time, you start with cluster. Then focus, checking, recall. Don't think that the train is just leaving and you might be missing. We are aware of all the things. Okay, I mean, so don't worry at all. So we know things. Your things will be covered. And nowadays we don't have much pressure actually. Previously we had much pressure because just every month recall was coming. We have to just update things. So it's been for last few months. Good and bad actually. For our side we don't have to update so much actually, unless I updated my slides and the things with animation and a lot of things and we change. It was easy to do that actually because we have a spare time to do those kind of animated things rather than an update. Yeah, so but as far as new recalls, the new recalls didn't test it because exam has been cancelled since May 2020 actually. Today it is 30th of January 2021. Yeah. So these are in generally your cases to prepare. From now on, when you prepare something, you prepare in this way. Any topic you write, what you have to do, either let me tell you what to do normally. Normally you just when you open up something, you check that case initially, is it given in the MAR1 file? Okay, initially basic. Then you can check some handbook cases. Is it available, similar case like that? Because we'll also give you a handbook case list. Okay, along with every condition will tell you if there is case available in the handbook. Okay, so it will be easy for you to find out. Then Karen is secondary. Nowadays, after, as I said, after MAR1 came, Karen is becoming secondary, but still it's a quite interesting thing. You can always keep checking the Karen actually, just to get idea as well. None of them are perfect. If you ask about perfection, none of them are perfect actually. So still you need to practice that. Then on the top, I mean, cherry on the top, I mean, our SMA notes will be, more than enough. Okay, still you can do these things because these are available in the market, and apart from that one, you follow our notes. That's how you keep preparing. So this is the maintenance phase. You just maintain with that one. You strengthen your knowledge. You build buildings after buildings after building. Then you start doing experiment if you want other academies notes to see, or what your friend is studying in other academies and the thing. I do my, as long as passing concert, you can do anything. You can do 2 online courses, they are very cheaper compared to a one single course in Australia actually. So I don't mind on that. As long as you pass, I always feel very good actually. That okay, and one person's problem is solved is always good. So, but initially don't do much experiment. Initially build up your knowledge, and later, if you want, you can do some experiment. As like that one, if someone has already gone through any academy, and yes, if it's Australian, then you have invested so much actually stuff actually. But if you have done through any online academy before, like you haven't invested so big amount compared to them, you can still invest in us and continue do these things. I strongly believe you'll be benefited actually. High tech things, from studio we take classes. These current things you have seen is quite updated. Yeah, and it's the most updated one. We guarantee our notice, updated the most actually, because we have recently updated and upgrade everything. Yeah, so that's how the slides looking very different as well. Yeah. So the summary here, you build your knowledge and keep letting stairs. You should have, study partner, 2 study partner, 3 study partner. Always keep discussing, make good groups like MCQ, and keep following those things. Take it from there actually. So first, finish this course properly as per I said. Then keep doing your experiment if needed actually. And during this time, if you can study maximum, I can assure you, online courses are quite enough to pass the exam actually, right? So that's one of the thing. And let's get back to slide. It won't take much time actually from you. Oops, I'm sorry. Yeah, my screen is visible now, guys. Screen visible. Some popular clusters. Yeah. Anyone can confirm me with response with yes. Is my screen is visible, guys? Someone can unmute and okay, thank you so much. Okay, so these are the cluster way to start actually, and you can also search in RCH guideline. You heard this name before, right, guys? This RCH guideline will help you tremendously here. RCH guideline. Quick checking. You are busy in a hospital, but suddenly it came to mind. Okay, Dr. Sharir has taught child with rash and child with vomiting. Okay, when the class will start, then let's check a little bit. So what to check? RCH guideline in that way. Okay, and a good doctor should always keep studying. Okay, a small thing makes something very big actually. Suddenly thinks this is not the area. If you want to do something very suddenly, go to stock market. Okay, take risk. In medical field, unfortunately, we don't have scope for that. We have to do in a smaller way and make it big. Actually. Yeah. So some popular these cases. Yeah, we discussed about the history, I guess, earlier. All these things we have discussed. It's not take much time here. Yeah, those of you who haven't joined us, feel free to call us, and it's fine actually. Our WhatsApp, Facebook, everything is active. You can contact us. And I'll discuss a little bit about the schedule. With my dear doctors, how we are planning. Okay, we'll discuss about the schedule in 2 minutes. If anyone does not know, because a lot of doctors we saw, they don't have idea. We have built things in 2017. Currently, we deal with almost 70% of MC students. At least MC, MCQ, we deal with highest number, no doubt on that one. Everyone knows. Maximum we deal actually, because we don't have center in Australia. Maybe that's one of the reason we couldn't do that big amount of students, lack of infrastructure. But this time we are quite sure about infrastructure, and the things will be quite good. The resources and the thing we have strengthening. Passing 450 doctor passed from our academy since 2017 we started, and in MCQ our passing so far is 95. In MC clinical, some people don't know our MC clinical doctors have also passed, and rate is 70. That's quite good actually. But it's, I think personally, it's tough to maintain this thing. But I will try to maintain it by 60 to this 75 always in future. That's taking as a challenge that at least 3 doctors go, at least 2 should pass definitely to keep this balance actually in any way. Yeah. So and working 100 plus at least, now even today when I was taking class, I was a little in stress. So suddenly one doctor messaged the doctor, I got the job. And one of my friend, you remember the another doctor, I'll not tell the name, that we were partners. Yeah. So what happened, doctor? I mean, she also got job. So both of them got job in Perth. Perth is, I mean, a lot of job happening in last time. They just in this month, our 7 doctor got job in Perth. Okay, so as I said, we'll try to make good community and the thing. Keep in touch with each other. If you need any paper from us, feel free to ask. Our academic paper you can also use to minimize gap. By the way, many people don't know that. I mean, as an attachment, you can always use anything which is related to medical field. Some people don't know that. Teaching, you're attending any courses with medical related training programs, observership, those all are things. So one is patient related, one is non-patient related. So non-patient related, this classes, courses you can always use. You can always use our academy name in your CV and all the thing. It's totally fine. So courses since are 4 months, 5 months. So those are with us like for 5 months with MCMCQ, and another, maybe you can add also another 5 months for clinical as well. So we don't mind on that one. Just let us know when you are using, just let us know, because sometimes they cross verify that thing. When people don't know, both GMC and AMC, our academy is a licensed academy, and both GMC and AMC, verified us actually that sometimes with candidates, and they give good feedback actually that no, it's been accepted actually. Okay, so there's a good news for an academy, even we are operating from Bangladesh, but as long as things are genuine, papers are genuine, income tax and all these things, so we have the license, so definitely it works actually. So do not hesitate using our papers actually wherever you go. Yeah, so you'll find me in social media. My name is Shari Ahmed Shuja, and you can find me. We have a YouTube channel. I mean, that's, I think, the only, quite organized YouTube channel. So far, I think the biggest for AMC. I mean, there's no other YouTube channel on only on AMC. And many thank personally that we never knew anything about AMC before you started the YouTube channel. So you can just go and click a subscribe or check some videos. I mean, about job and many things. At least the basic all things are given there actually. And for a starter, it's a very good hub actually. Okay. And our Facebook page is this. If you like classes, you can always keep reviewing online. So that's, I don't push people for this thing. And our local office is here. This is our email, and these are our 3 numbers. If anyone from Australia, you can also WhatsApp on this number actually. Since I'm here right now, so but when I'll be there, then it will be active. For now, you can WhatsApp in this number, or these are also active with the phones. All right. So anything left? Yeah, we need your support to build best MC clinical community, and ensure best passing thing. So this is Dr. Shariar, I mean, your mentor. And a little bit before I left, and I'm giving you a little idea about this thing, about this syllabus and coming up things. So we will be starting. Just for now, you take a snap and the thing. I'll update you guys more, because we're just in the beginning part, right? Still admissions going on, a lot of things are going on. We do have class on Tuesday, guys. We do have class on Tuesday, because I want to at least finish the theory before your role play. Okay, so I want all of you, I'll give the names. I'll specifically fix your names. Everyone has to do the role play thing. Okay. So everyone knows, I mean, maybe bad habit you say or things, I am very careful about my students, but also sometimes, a little bit, strict about rules regulation, but I think it's good actually for your betterment and to make things happening in the right direction, right way. It's always good actually. People come to centers because of, rules, regulation, and some techniques, right? I mean, otherwise you could have study of your own. So that thing is important. So weekly you'll study more things. So before studying the role play. So there'll be the Tuesday class. So as you can see, the theory, I mean, I'll be covering what things exactly necessary for pediatric theory for the clinicals actually. So that will be a new addition, and it will be a very useful one for you actually. Yeah, this is a very new addition actually. I'm telling you, this is a very new addition. The pediatric theory only based on the clinical actually. So example, if it's related to any examination or anything else, and also those are added here, that class will be also telecast here. So you can also see that one up to class 4, everyone can attend in this group, just to see, you know, how we are doing with the pediatric history, then the theory, then to role play, everyone can attend. Okay, so then if those wanted later can join the remaining. So classes would be like surgery things, quite extended. Yeah. So as I said, it's a complete one, but for now, just showing others. That's our syllabus to finish up things. Actually, we might need almost a month because it's pediatrics, so taking a little time. Next day would be Tuesday. I mean, as you can see, guys, Tuesday we have a class on the pediatric theory. Then we'll give you 3-4 days more time to read those things and come and do role play with us. We'll specifically fix your name, like for the role play, and anonymously, if 1-2 people want to do role play, we'll also allow them. Not a problem actually. Even anyone wants to do role play, please do let me know actually. From 9th we'll do the role play things. So in that case, if anyone, even not student, want to do role play, just send your name. We'll fix the names before doing the role play. All right, so that'll be great. I'll take some questions now from the dear doctors. I mean, feel free to ask me. I mean, what do you look forward here? And okay, some doctor asked me, okay, doctor, I mean, will you include the physical examination? Because yes, I mean, we also will include the physical examination. Okay, so this is a great thing actually. So this time we are ready fully with physical examination thing actually. So when we'll do that, our previous batch doctors will also get chance to attend that one. We'll also inform them that time actually. I mean, no need to worry, the examination, I mean, exam hasn't started yet, so you don't have to worry much actually. So don't worry about that one. So the question taking time now. So this is the syllabus, I mean, for the pediatrics, followed by there will be more things like surgery, medicine, gynae ops, and so on. Things will come up. Anything, dear doctors, and how do you feel about the class? Was it a very boring one? How's the presentation and the thing? Don't judge me about the role play, because role play is still to come, but I hope so. This time I'll give feedback, exactly how the examiners give feedback. You should also see that on the 9th, like exactly how feedback is given. So you will see that the exact marking, what you have said, what things will be. Yeah, so that's the thing. Any last words, guys? I think we can patch up today. I mean, yeah, thank you. All right. Okay, great. Thank you all. I mean, so far so good. Yeah, so far so good actually. Don't worry. I mean, you'll be more confident about after the theory class, because some people are in dilemma. What actually I need to study from pediatrics? So I will help you with that one that time. All right. Have a lovely day, guys. Thank you. This is Dr. Sharir, your answer for AMC. We'll see you in another class very shortly. Have a lovely day. To contact us, one more time, these are our details. If anyone wants to contact us, feel free to contact us by the details on the numbers. Have a lovely day, dear doctors. Stay blessed. Keep supporting each other, keep pray, and keep helping each other actually. So no one is no one's enemy. Whoever have the marks will pass the exam. Always remember that. So feel free to help people pass the exam in quick session, help each other, try secure a job. As I said before class, I was stressed out when that one doctor called and said she got the job and her friend got the job, both in part. I felt very good actually. So this kind of thing I'm also expecting. This thing will happen. There's a word by Nelson Mandela, and he said, it is always seems impossible unless it is done, right? So the same goes in AMC actually. It is always seems impossible unless it's done. The job in Australia as a doctor is also seems impossible unless it's done, right? So in that note, I mean, it's always possible, guys. I mean, I can see, you know, at a time we also don't believe that so many doctors can. But now 100, I know even those are were my students before or have gone through my academy. Now they're doing job and felt it very good. That actually a lot of job they're getting it actually. Just make sure that you apply and do things in right direction. Will guide you. I mean, we'll guide you more. After pediatrics will guide you. It's too early to guide, I mean, during pediatrics, but once pediatrics will be done, we'll guide you more on the job related thing. As I said, Dr. Qureshi will separately guide you guys more. She has a lot of interview question and collection, so she will help you with those things. Okay, how to apply, how to write CV, how to correct CV. You can ask her. She's very friendly. You can ask her also. So good luck. Thank you so much. Have a lovely day. So I'm just closing down.